This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
If everybody could have their seats, we will get started on this hearing. And I'm Senator Jim Bell, Chairman of the Senate Committee on Transportation and Housing. And we're really proud to be here in Los Angeles City Hall to have a hearing on the chronic state of homelessness, identifying proven solutions to end and prevent homelessness in California. The Senate Committee of Transportation and Housing is assigned this responsibility in the legislature to work on these issues. So we are having a hearing today, this morning, and afternoon we will be out on the field taking tours of various facilities in the great city of Los Angeles. So we'd like to appreciate everybody being here, and thank you for being here today. And we'd also like to thank the Mayor Garcetti and the city of Los Angeles for allowing us to use their facilities and hosting us, and also participating in the discussion of what the solutions are. I think so. Can you hear me? Oh, it's not. Is it better that way? So maybe I ought to get real close then, huh? Okay, this is good. Now, as chair of this, is that okay now? No? Yeah. Okay. How's that? He's gonna make it a little louder. All right. Now, over the past several years in California has begun to see an overall decrease in the number of persons experiencing homelessness. However, last year, the city of Los Angeles saw an overall increase in their homeless population. Now, according to the annual report by the United States Department of Housing and Urban Development, California is home to 20% of the homeless population in our country. And California has the highest rate of unsheltered homeless persons at 62.7%, highest in the United States. Now, these staggering numbers have led some jurisdictions, such as the city of Los Angeles, the state of Hawaii, and others, to consider declaring a state of emergency due to the homelessness that occurs in their communities. The simple fact is that Californians find themselves without clean, safe, affordable place to call home, and that is morally unacceptable. While the solutions to homelessness are well known and may be obvious to some, California has proven to be a particularly difficult place to address homelessness. And first, we've had dramatic cuts in spending at the federal level and the loss of redevelopment money in California, and the lack of a permanent source for housing at the state level. Locals and service providers must do with much less. California has a shortfall in the state of 1.5 million affordable homes. Not a single county in the state has an adequate supply of affordable homes, while the median incomes have dropped by 8% since the year 2000. Rental prices have soared by 21%, and in some cases, in some areas, much, much more. Finally, California requires the third highest wage in the country to afford housing, behind Hawaii and Washington, D.C. To afford rents and utilities without paying more than 30% of their income for housing, a household must earn an hourly housing wage of $26.65 per hour. I'll say that again, $26.65 an hour to afford rent, utilities without paying more than 30% of their income for housing. That's astounding. This means that a person earning a minimum wage must work an average of 3 jobs to pay the rent for a 2-bedroom unit. And this serious shortage of housing supply directly not only affects the future health of California's economy, affects the health and education of our children, the environment, and overall quality of life. Those of us in the legislature who follow and care about housing issues are very aware of this and are desperately seeking ways to both meet with our constituents' housing needs and maintain the capacity of critical affordable housing industry. I'm also acutely aware of the special needs facing vulnerable populations, such as foster youth, those afflicted with a mental illness, and single mothers with children. As a chairman of the Senate Transportation and Housing Committee, it's my belief we can and do much more for these populations. Now that California's economy is a little better, I'm confident that a major focus of this year's legislature will be to devise and innovate financial tools to house the homeless and make housing more affordable for those most at risk of becoming homeless. And I look forward to continuing to advocate for those who do not have a voice in finding a long-term solution for our state's affordable housing needs. And I'd like to ask my colleague, wonderful colleague who's been such a strong advocate for housing as well, Senator Carol Liu, if she would like to make some remarks. Carol?
Thank you very much, Senator Bell. I just wanted to, he gave you a wonderful overall viewpoint from the state's point of view about the condition we are in. And I want to thank you very much, and you and your staff, for coordinating the committee hearing today. I'm not a member of the transportation, I'm Senator Carol Liu from the 25th Senate District, which is a neighboring district up in the Glendale, Burbank, Pasadena area. And I'm not on the Transportation Housing Committee, but I did carry a bill this last year that is parked in the Transportation Committee dealing with the criminalization of homelessness. So I'm very concerned about what we are doing as a society and what we're doing as a governmental entity, and how we can better coordinate our services together to try to address some really knotty problems of our current condition here. We were talking about poverty, we're talking about affordable housing, we're talking about health care and mental health. All issues that, unfortunately, in the Senate budget or in the state's budget, occupy a very small space, and so we're concerned about. And so that just to let everybody know that there are people in the legislature really concerned about how we conduct ourselves and how we're going to better address the needs of the community as a whole. And I really do thank all of you for being here, because I'm interested, and I know Senator Bell is interested in hearing what you're doing here in Los Angeles. And I know that this is such a very serious problem, and it's really hard how we as government entity or we as a society should be judged by how we treat others, and the least among us need to be addressed adequately. So with that, Senator Bell, I really appreciate your invitation for joining you, and look forward to working with you this fall.
Thank you,
Next
Senator
year.
Carol Liu. And Carol sits in front of me in the chambers of the State Senate, not behind me. She sat behind me. She wouldn't see anything. She sits directly in front of me, so we talk about this quite a bit. So I'm really pleased to be here, and we're going to ask our wonderful Mayor Eric Garcetti's representative, Greg Spiegel, the Homeless Policy Coordinator of the Office of Mayor Eric Garcetti. So thank you, Greg, for coming to our hearing today, and thank the Mayor for his prominent advocacy for the homeless.
Thank you. It's my honor to be here, and thank you so much for prioritizing this issue and coming down and to be willing to hear from some really informed stakeholders today. It should be a really good program, I think. Just want to take a few minutes to talk about the city of LA homelessness problem. It's certainly one of the most critical problems facing California, homelessness, and it's to your credit to raise it up and want to address it directly. City of Los Angeles is about 26,000 homeless people on any given night, about 18,000 of which are unsheltered. One thing I want to share is there's a lot of, everywhere I go around the city, every neighborhood says, the homeless people are coming from over there, or from Iowa, or from somewhere else. But what we do know about the homeless count is that this is a homegrown problem, that 93% of LA County's homeless people have been in Los Angeles County for more than a year. That's a higher percentage than the general population. 77% have been in LA County for more than 10 years. This is not a migration problem. This is a local problem. This is a California problem. So there's lots of bad statistics that have decades worth of sources, but there's been a lot of good work done recently, and I want to share a bit of that. Countywide, last year, we permanently housed over 11,000 people using the coordinated entry system that was developed as part of a collaboration under the umbrella of Home for Good, led by United Way and the LA Chamber of Commerce. That has helped to bring city and county together in a way that hasn't been true before. Just on Tuesday, HUD Secretary Castro was here, and the city council and the mayor went up to the county, and we all came together around a table about how we're going to work together, private sector, public sector, to bring resources to bear. And to talk a bit about resources, just on the city basis, on September 22nd, there was a joint press conference with the mayor and city council. City council committed to $100 million to homelessness. The mayor has proposed $100 million every year to homelessness to really make a dent in this problem. Short term, the mayor's proposed $13 million, the majority of which would be for rapid rehousing money. This is just out of the budget surplus right now that we hope to get out in the next month. And this rapid rehousing money is money, short-term subsidies to get for people who don't need the long-term subsidy to end their homelessness. 6 to 9 month subsidy that gets them back on their feet and off the street. We think this is a really appropriate role for local subsidies, and that's something we're going to pursue in a much larger way in the new year. And we're doing so in this joint planning process with the county, where we hope ends in coordinated plans, one by the county, one by the city, in February, passed together that fit together so they speak to each other. So we have housing authority policies that are consistent, policing policies that are consistent, sanitation policies, housing policies, so that we're working together. A little update on the mayor's pledge to end veterans' homelessness. The mayor committed last year to trying to end veterans' homelessness. Since January 1st of 2014, in the city of Los Angeles, we've housed over 4,600 homeless veterans. It's more than anywhere else in the country, more than all the other cities that have claimed to end veteran homelessness together. We're housing them faster and as a pro rata share of our population. But we still have a long way to go. There's still 2,400 more veterans to house, and we're doing everything we can as fast as we can to do that. Just a few words on the mayor's strategy to end homelessness. First, we have to house everybody who's currently homeless, and to do that, we're going to have to scale up this coordinated entry system, and that's a funding. We need staffing, we need interim housing resources like shelter, transportation, move-in costs, and we need permanent housing subsidies and supportive services in a big way. So that's something that's in the mayor's plan and will be part of his $100 million a year proposal. But it's not enough just to house the people who are homeless, and that's why it's really important that you hear. We have to prevent people from becoming homeless. So on the veterans front, we've housed 4,600 in 18 months. That's gigantic. But every day, 4 to 5 veterans become homeless in the city of Los Angeles. Just in the city, every day, 4 to 5 veterans become homeless. We can't simply wait for them to become homeless. We have to prevent them from becoming homeless in the first place. And that is an affordable housing problem. Chairman, you said some really powerful statistics about that. I wanted to add one more that I heard from Economic Roundtable, and that is that in the county of Los Angeles, there are 500,000 people right now who are in less than the federal poverty level who pay 90% of their income on rent. 90% of their tiny income is spent on rent every month. They are one sneeze away, one car repair away from homelessness. So we have 26,000 people in the city who are homeless. That is the tip of an iceberg that is ready to go above the surface if we don't deal with our affordable housing problem. We need your help to address affordable housing. As you know, the last several years have been drastic cuts in the federal funding for affordable housing and home funds, and the sequester reducing Section 8 vouchers, and it's been in the state level too as we lost redevelopment funding, and we really appreciate your advocacy for AB 90 and AB 1056 and the legislature's efforts in 1035 and 35, but we didn't get them, and we need much more. And we're here to tell you, I think everybody here is to tell you today, that any funds that come to the city of Los Angeles and the county of Los Angeles will be used efficiently and rapidly. We have a coalition, we have collaboration like never before, we're removing inefficiencies, we've got projects ready to go on the street. If you can provide us the money, we can house the people. So thank you so much for being here. Yeah.
Yes, and we appreciate you being here, and thank you for all the good work the mayor is doing. We're going to do our best to work with the city of Los Angeles on devising legislation and budget solutions over the next year, and I appreciate your offer to help us do that.
We look forward to that partnership. Thank you.
Okay, next we're going to have a little panel. We're going to invite them to come forward. We have a group of people that are going to speak. Amy Sawyer, Regional Coordinator of the Interagency Council on Homelessness. I think she's here. Cynthia Kavanaugh, Assistant Director of Homeless and Housing Policy for the State of California. 2 community advocates, Vicki Vickers and Sophia Prieger, are here. So we'd like to ask them to come forward. Thank you. Okay, we'll ladies, thank you. Thank you. Okay, we'll start with Amy. Amy, welcome, and thank you for being here.
Thank you. I'm really glad to be here.
Push that. There's a button and there's a green light that goes on there. Yeah.
Oh, thank you. Much better. I have a quiet voice. I'm very glad to be here today. My name is Amy Sawyer, and I'm a regional coordinator with the U.S. Interagency Council on Homelessness. Very interested to hear from the presenters today about how all the puzzle pieces that have already been raised really fit together. So I'm going to be listening very intently and look forward to ongoing dialogue with you and the folks in the room. Before I give an overview of some of the priorities we have nationally, I want to take a minute to just recognize some of the work that's happening right here in California right now. Across the state, 35 mayors and supervisors have signed on to the Mayor's Challenge, and this really demonstrates a commitment to ending veteran homelessness, but also signals and serves as a driving force behind the movement to ending all types of homelessness. And many of these same mayors are part of Zero 2016, which is a rigorous, data-driven effort designed to help communities end chronic and veteran homelessness. But really, it goes beyond that. It's faith leaders, businesses, community leaders. They're inspiring change and collaborating at unprecedented levels. No longer are we asking if we can end homelessness, but when. When will we end homelessness? So there's no doubt that there's a lot of hard work ahead, but I think California is positioned to take on this challenge, in part because of leaders like you who truly care. You really want to understand how families and individuals struggle and what they need to move past that struggle. So homelessness is something that in the past and even to this day has been exacerbated and even caused by systems in our community, compounding the issues of everyday life that people face. So often when we see someone who's homeless, it's not at the point of the housing crisis, but it's days or even months after the experience of homelessness, and they're in total survival mode. And this is extremely different than the state that people have when they're in safe, stable housing. And even more unfortunate, for many of us in the community, we don't see the thousands of families, youth, and individuals who experience homelessness in California every day. People who experience homelessness certainly face job loss, health problems, domestic violence, family rejection, and other destabilizing life events. But at its core, homelessness is a housing crisis, and we have the solution to that: housing. With my remaining time, I want to talk about some of what we're doing at the federal level and some of the framework we use and how we're looking across the nation to put the puzzle pieces together. At the U.S. Interagency Council on Homelessness, we remain focused on working with our 19 federal agency members to implement Opening Doors, the federal strategic plan to prevent and end homelessness. And we're driving towards achieving the plan's national goals, which is to end veteran homelessness by the end of the year, to end chronic homelessness by 2017, to end family and youth homelessness in 2020, and very importantly, set a path to ending all types of homelessness. And I think this last goal is really about ensuring that we have sustainable solutions to quickly identify people who in the community who may experience a housing crisis and match them with safe, stable housing before homelessness becomes a way of life. By ending homelessness, we do not mean that no one will ever experience housing crisis again. Larger forces in our nation and our states will, at least for now, still impact access to resources, so individuals and families will face challenges when it comes to housing. Rather, ending homelessness means that every community will have a system built to ensure that homelessness is prevented whenever possible. And when it can't be prevented, it's rare, brief, and a one-time event. So this means that communities will have capacity to quickly identify and engage people in crisis. They'll be able to intervene and prevent the loss of housing whenever possible. And if homelessness does occur, the community will be situated to quickly respond with emergency housing and crisis response that's barrier-free while actively working to connect people to stable housing as quickly as possible. So when a community has this type of systems approach and housing-first orientation, it allows people to answer the question collectively: how will we coordinate all of the resources at hand across programs to ensure that each individual and family experience a housing crisis can connect to permanent housing that's the best fit for them? So this response can range from ensuring access to subsidized rental assistance through things like housing choice vouchers or Section 8 for people whose incomes prohibit them from accessing the rental market. Can include rapid rehousing, which often pairs shorter-term rental assistance or financial assistance to pay for arrears, move-in costs, deposits, and rent, with housing navigators and other supports people may need to access that housing. As well as supportive housing, which pairs longer-term rental assistance with deep supports to help people sustain that housing, such as mental health or substance abuse supports. And I think it's also important to note that sometimes rental supports aren't required, and instead it takes support to help negotiate with a landlord or a family member to sustain the housing. But we do know that even the most robust housing system can't stand alone. The numbers are too big and the puzzle is too complex. So people need to be connected to meaningful work with wages that pay the bills, and they need to be reconnected or connected to benefits like Social Security or child care subsidies. And this can help people fill the gaps that most low-wage workers in this country need or have. And at the federal level, we're really working hard to make it possible for people experiencing homelessness to access these types of benefits, health care, and job opportunities that they need to stabilize their lives. So this is not just a theory or an ambition, it's an achievable goal. We know this because across the country, communities have already achieved it for veterans, and you've heard New Orleans, Mobile, Alabama, Troy, New York, Flagler County in Florida. There's other communities that are really big and small that have approached us to talk about their achievements, and we're looking at what they're doing with them. So what accounts for the success? They embrace housing first principles, hands down, across the whole system. They're targeting supportive housing resources to people who need it the most, which is people experiencing chronic homelessness. They have robust collaborations between the continuums of care, which is the community collectives and strategic planning bodies, the VA medical centers, and state partners. And lastly, these collaborations really allow for coordinated implementation of resources across multiple systems so that they can align strategies to effectively target and prioritize resources and to get the outcomes we want, which is connecting people to housing. So I'm going to close by talking a little bit about the important partners that states can play when it comes to ending homelessness. We're really seeing states gain traction through a variety of strategies. States can invest in what works, right? And it's beyond housing. It's also leveraging state investments in child welfare, programs like CalWorks, criminal justice, healthcare, and housing to ensure that they drive permanent supportive or permanent housing outcomes. And this same type of coordinated state effort can make it possible for state agencies to develop a housing-first orientation, identify key staffers in each agency who have the ability to work within the agency and across agencies to make real decisions that will align resources. The state can also accelerate progress and strengthen outcomes in communities by creating alignment around what strategies are important, allowing innovations in particular communities to scale up and be applied statewide. And you can also ensure that your state comprehensive plan on housing is aligned so that when there are resources available, they are deployed in the most effective way, gearing units towards the most vulnerable people with the lowest incomes. And as communities work to leverage landlord relationships and create opportunities in existing units, states can help communities by raising awareness. They can ask if multifamily developers are prioritizing resources, and they can help support public housing authorities to target housing to people who need it the most. As I've mentioned, we've seen great progress with veterans in part because of the real collaboration and commitment and resources at the federal level. With other populations, we have not seen those federal resources yet, which is why we pushed our goal to end chronic homelessness back to 2017. But we also know that the scope of the challenge in California will take resources from everywhere, not just federal, but state, local, community foundations, businesses, everyone. So if we're going to get the job done, leaders in California will need to double down on collaboration and bring everyone to the table so you can fit all of the pieces of the puzzle together. So here at USICH, we are committed to working with California to do this, to meet this challenge. And particularly as the new regional coordinator for California, I'm very excited to walk arm in arm with you down the road to ending homelessness for everyone. Across the country and in California, we are forging ahead to end homelessness among veterans, people experiencing chronic homelessness, families and youth, and really anyone who experiences a housing crisis. Together, we really have a chance to do this right. This is a historic time in our nation. At every level of government, public and private sectors are coming together to find real solutions. We can seize this moment and sustain it, sustain momentum with leaders like you. So thank you.
Thank you very much, Ms. Sawyer, and we'll now hear from Cynthia Kavanaugh, our Assistant Director of Homeless Policy for California.
Thank you. Thank you for the opportunity to be here. I love Los Angeles. I grew up in Los Angeles. I just need to say that. But also on this topic, and at the state level, we are also learning a lot from Los Angeles, I want to say. I'm from the Department of Housing and Community Development, and along with the California Housing Finance Agency, we primarily implement housing finance and some homeless service programs that are targeted to homeless populations and at-risk populations. And I'm going to highlight and give updates on a few of those programs, as well as some other broader state agency activities that are geared towards homelessness in California. I think there are three main ways that the state can continue to address homelessness, and it may sound a little repetitive of what you heard from Amy. First, through deep and continued interdepartmental work, and that's at the state, between state agencies, but also with local agencies and with federal agencies, to really better coordinate and leverage each other's work and strategies and investments. Secondly, whether it's through state program design or delivery or through policy or technical assistance, the state can play a role in supporting and incentivizing local communities to build these effective crisis response systems, and a key part of that is coordinated entry. What's happening in LA may not be happening at all, or to different degrees in other parts of the state. So there's a lot we can learn from each other, and the state can play a role there. And then I think that the third underpinning is that we need to inform the state housing, social service, and health investments in crisis response, in housing, and in services to align with the HEARTH Act and other evidence-based practices. And I'll illustrate some of the work going on there. In 2013, the state HCD and CalHFA, let me mention, was one of 4 states to participate in the SAMHSA Policy Academy to end chronic homelessness. And in that year-long process, we were in consultation with federal agencies, but also with the local efforts underway. And there is work, we came up with not a plan, not a long plan, but really we identified where were the key opportunities for action, and they were under 4 main goals. My position came out of that, so it is a single state position to at least have that eyes and focus on homelessness and to begin some of this coordinating effort. We began to understand the shifts happening in the field as well as under the HEARTH Act, and I just want to iterate some of the 3 sort of main shifts that we observed: moving to the coordinated crisis response systems and permanent housing interventions, such as permanent supportive housing and rapid rehousing that end homelessness as quickly as possible. Understanding that homelessness is too complex for one system or one level of government, and understanding that to be successful, these housing interventions require coordination with services and mainstream services, such as Medicaid, CalWORKS, reentry, or child welfare systems. So let me, since then, we've also received additional HUD technical assistance, and we have some work underway I would like to mention as well in 2 areas. We are redesigning the state's Emergency Solutions Grant Program, which is a federally funded program. Most of the money goes directly to the large communities, but we do administer about $10 million for the non-entitlement areas. And we're looking at ways to coordinate more closely instead of doing a statewide competition where we really do not have good geographic coverage. We're looking at ways to work more closely and align with the continuum of care investments, again, in the non-entitlement areas. We have regulations currently out for comment in that program. And we've been working about the last 2 years on that. We are also working in this with this same HUD technical assistance to deliver two-day trainings on rapid rehousing, which is a key strategy in the north and the south of the state in early November. And we're partnering with the Department of Social Services to reach not only the ESG providers and administrators, but the CalWORKS Housing Stabilization Program providers and administrators to really deepen the knowledge on rapid rehousing. That program has now 43 participating counties at a $35 million level, which funds rapid rehousing for CalWORKS families. And I think that's a pretty innovative state initiative that we can learn from. Also, we have partnered with federal agencies and through a HUD technical assistance on the H2 or health housing or or H squared initiative, which is the main intent is to provide technical assistance to local communities to help them to bring together partnerships in health and in housing and in service delivery to understand what's available under the Affordable Care Act expansion. And we started with a one-day forum to help communities in the Central Coast develop plans and to begin that conversation. I'm going to talk for a few minutes on the state's housing programs and really the recent housing programs and what they do or might do better to really impact homelessness. We believe that those programs that align the housing investment with the mainstream services to a carefully targeted population are the most effective models and often involve interagency collaboration. The MHSA program is winding down, the state MHSA program, I should say. It will expire in 2016, but it has been successful in building housing for a population that needs ongoing services, needs special outreach, and has been hard to reach or serve. CalHFA is working on the next version of that when that initial program funding is gone on a voluntary basis with counties. Though winding down the bond-funded programs that HCD and CalHFA have administered have built thousands of supportive housing units. So I wanted to mention that program. And through 2013 legislation, the targeting was strengthened, and I think that was important to actually have that housing reach the population that it's really intended for. The Veterans Homeless and Housing Prevention, Housing and Homelessness Prevention Program was approved by the voters in a couple years ago in Proposition 41. It's in 2014, okay. It will, over the next decade, provide for about 3,300 permanent supportive housing units for veterans, potentially serving 1,200 homeless veterans that are experiencing chronic homelessness in the next decade. We've just released the second $75 million NOFA, and I want to highlight a few changes to this program that I think will increase its effectiveness in terms of this problem. And that may be lessons learned or things to look for. But some of the new things we did was we required housing first practices in supportive housing, use of local coordinated entry, local collaboration, that targeting to the most vulnerable, geographic targeting of the funds based on need. That's a concept that's new for a state program. And recognizing the need for operating support, whether it's through the program or through the housing authority or through VASH vouchers, that if you're going to reach this population, you really need to get down to a very, very low rent. Briefly, we're implementing 2 competitive rounds of the 811 project rental assistance demonstration. That program also an interesting model and funding mechanism. It tags along to state-financed housing, so it doesn't finance the development of housing, but buys access and affordability and brings along services to a targeted population. Our second round, the first round was really targeted for folks that are in long-term institutions that can live in the community with support. And the second round was is a pilot just in Los Angeles County that expands the target population to include those persons experiencing homelessness. So, yes, so that's just another program I wanted to mention. And here to learn. There's stuff happening in the health world with the 1115 amendment still underway, still in negotiation with the Centers for Medicare and Medicaid Services, as well as the Health Homes program. Both of those, in general, will hopefully leverage Medicaid funds in services in housing for this population. And with that, I will close.
Thank you very much. I think we'll now hear from our community advocate group. And welcome, and we're really excited to have you here and hear what you have to say. So we'll start with Vicki Vickers. I guess
Thank you, Senator.
You drew the lot to start. So go ahead.
Thank you very much. This is the second time I've sat in front of you. I think I did. I just have a very low voice, I guess. I want to thank you, first of all, for the rapid policy change that you and Senator Mitchell made happen with the police and the mentally ill and how they approach us. I've seen...
Got the bills signed into law.
Yeah, just like that. I mean, that was amazing. I've actually seen the difference in how police approach people myself living in downtown.
Thank you very much. We'll keep working on that.
Thank you.
Those were bills that I introduced, SB 1129. The governor signed a law that requires police departments to do training on mental health and developmental disabilities issues and cultural competency. And those bills were signed into law by Governor Brown. And they'll be part of the training regimen of our law enforcement training programs that we have in California.
Thank you. I'm a resident of the Downtown Women's Center, LA Street site, and I have schizophrenia. About 7 years ago, I felt my medication was poisoning me. I was in psychosis. I didn't know it. My medication had stopped working. I became afraid. People have either, fight or flight, and I always become afraid when I'm in psychosis. Well, at that time, I was hallucinating about enemy armies invading America. In my mind, I and my family were their targets, and although no one else could hear or see them, the enemies invading were my reality. So I ran away. I cut off all contact with my family and anyone else I had ever known. I believed that if I was in contact with them, I would be putting them in danger. I found an old abandoned park behind the old Santa Monica Library. Gratefully, there were homeless vets that lived there, and even though they knew I was out of my mind crazy, they gave me a place next to them and kind of looked out for me. It was there that I lived for 4.5 years. Through kindness from a stranger, I got help. A man would come by once every week or 2 weeks, and he would drop off food from the food pantry. And he noticed that I had become very ill. I had open sores all over my body from not being clean, and I had a really bad bronchitis that I just couldn't get rid of. And I, at that point, was afraid of going to the doctor. He talked me into finally going to Ocean Park Community Center. I did finally. And not only did I see a doctor that was there with the Rose Family Clinic, who has a clinic inside Ocean Park Community Center, but he gave me antibiotics and he made sure I received an emergency caseworker. This is what started my journey home. I was given an emergency bed at Daybreak for women. I stayed there for a month and a half. I went to the psychiatrist, whom the doctor from Rose Family Clinic advised me to go and see at Edelman's West Side. I started a new medication that actually started to work. I followed the rules there. I did my chores. I went to the psychiatrist, and I started to make friends. But I was always worried that my time on the emergency side of Daybreak would run out, and I would have to go back out into the streets. Gratefully, that didn't happen. For me, it was a miracle, but I'll never understand why. No one ever explained it to me. But I was given a bed on the transitional side of dairy break for women. I finally had a stable place to sleep, and I started to come out of the psychosis. I had a new caseworker, and she met with me regularly. I had no idea at this point. I'd been on the streets for so long. I was in such a condition that just functioning again was very difficult for me. So this caseworker led me through paperwork, applications for housing, everything, step by step, explaining everything that I had no idea how to do or understand. One day she asked me if I would be interested in a place called supportive housing here in downtown LA. Not believing I would be accepted, I did as she recommended, and I signed my name on every line that she told me to. About 2 weeks later, I got a message I had an interview. And I went down here to the Downtown Women's Center. I walked into this beautiful building, and I thought, there's no way they're gonna ever accept me here. But I got through the interview with help from a staff member from the Downtown Women's Center who had gone with me for support. And about 3 weeks later, after I'd left, I was too afraid to hope, I guess. But about 3 weeks later, my caseworker walked up to me, and I was sitting at the table in the day room, and she said, "You've been accepted." So after that long, I finally had a permanent place to live. I couldn't believe it. I've been there now 3 years, November 1st. I'm stable. I no longer have hallucinations. I'm an advocate for the homeless and mentally ill with Corporation for Supportive Housing. I speak to anyone who will listen to hopefully bridge the gaps of understanding, put a face to homelessness as who I am, just a person who survived it, and that everybody has somebody in there. Every homeless person, there is someone in there who can do great, amazing things in society with just a little bit of help. Low-income, affordable housing, I believe, is the only way to go. There's no possibility that someone coming off the streets after being homeless a year, 6 months even, is so hard on the body. It takes so much support. I had 20 cavities filled the first year, and I wouldn't have even gone to the dentist had it not been for the staff in my supportive housing at the Downtown Women's Center helping me get that appointment and making sure that I went. Downtown Women's Center, I believe, should be a role model for all of the housing for homeless in supportive and for affordable housing. We have a 95% success rate in retaining housing. Women that live there almost never return to homelessness. So, I'm only here to say thank you to all of the funding. That funding saved my life. I honestly believe I wouldn't be here. I'd become so ill by the time that I finally did get help, that if I would have been out there another year, I just don't believe I would have made it at all. Like I said before, am just like any person. I am a person. I didn't know how to get up off the street anymore. I didn't know where to go or what to do. And I see the movement of supportive and affordable housing going in what I believe is a successful direction. It worked for me, and I believe it can work for anyone. Thank you for hearing me. Senator, I just have one thing to ask you, please, for the homeless people that are still sleeping on the sidewalks. Please, in the downtown area, our sidewalks are so incredibly dirty. Could you please do something about that? Thank you, sir.
Thank you, Vicki.
Sure.
Hi. I want to thank you for having me to speak here. I'm really glad, Senator Liu, that you are very passionate about the foster care system. I myself was a product of the foster care system, and I appreciate all the bills that you've helped lobby for and all that, and as well as you, Jim Beal. Thank you very much. Speech I normally do is kind of lighthearted, but it's okay. Every year, about 20,000 foster youth age out of the system on their 18th birthday, for some 21st if they're lucky enough to get into transitional housing. And by age out, that basically means they get kicked out on the street. And many of them don't have the life skills necessary to survive. They don't know how to cook, they don't know how to balance a checkbook, they don't know the bus schedule, they're lacking basic living skills. So naturally, many of them end up homeless. I was one of them. My name is Sophia Preger. When I was 2.5 years old, I got on a plane from Siberia to the United States. I came with my family, and I am diagnosed bipolar. I have 2 sisters who were recently hospitalized and also diagnosed with mental illness. So I guess it might be true what they say about the crazy Russians. But I started doing drugs when I was 12 years old. 12 years old. But at the same time, I was doing exceptionally well academically. I was on the honor roll. I was in gifted and talented education. I placed first in the National Academic League in the state of California. By the time I was 14, 15, I was a regular runaway, and I was using drugs regularly. Unfortunately, but also fortunately, I got arrested and ended up in juvenile hall, where the only thing I really had to do all day was stare through a 6 by 12-inch window, unless I was fortunate enough to have hidden a pencil and a piece of paper in a hole I made in my pillow. So I spent a lot of time looking out that window. I went to Metro State Hospital afterwards, and luckily for me, I got to wear my own clothes, so that was an improvement. But then I ended up at Vista Del Mar Child and Family Services Group Home, which is a fantastic place with a wonderful supportive staff and grounds and great classes. Yeah. So then after that, I ended up in transitional housing. But before that, I jumped around through various housing situations, from homeless shelters to sleeping on people's couches to sleeping at Union Station at the train station, being a little bit afraid at 18, wondering what's going to happen as people get out of central jail at all hours of the night. I secured housing for myself for 6 years without any assistance whatsoever from the transitional housing. With the only thing they let me do was use the staff computer. So I logged onto the HUD website by myself at 20 years old and figured out and applied to every single HUD building in the LA County until one of them finally called me, gave me an interview, and I got there. I was there for 6 years, but unfortunately, due to mental illness and drug abuse, I had the choice to either be evicted and not be able to obtain housing in the future or go to rehab. Naturally, I chose rehab. And I went through rehab, and I went through outpatient after I did inpatient, and then I got lucky enough to secure scattered site supportive housing, which basically means I have services, but I rent a unit. I have a very nice duplex in East Hollywood. It's a house. It's a half a house. It's in the community. I started planting flowers. I have a sunflower plant all the neighborhood boys pick to give to their girlfriends that I see them walking around with my sunflowers, but I don't mind. And it's given me a chance to calm my life down. My life is stable. There's none of the chaos of mental illness or drug abuse. I've been off of drugs for over 3 years. I went back to school to pursue a degree in psychology and human services. Having a house is a foundation for getting your life back together. It allows you to get your health care together. It allows you to get your mental health together. It allows you to get your family life back together. It allows you substance abuse, whatever issues you might have. If you have a home base to call home and a place you can coordinate everything, it'll be able to solve that. And speaking on housing and foster youth, yesterday I went to my psychiatrist appointment, and they have a new intern, and we were talking, and she's foster youth. She's in college. She is currently homeless. She's 21 years old. So you have young people that are more than willing to work and get a job and take care of themselves. There's just a lack of affordable housing. I mean, some of these units are like $1,600 for a single, and unless you're making like 17, 20s, 80, like it's nearly impossible for a young person to afford to live on their own. And without subsidized and affordable housing, it's nearly impossible to end homelessness. But we're making great strides in that, and I want to thank you all for your positive work in that area.
Well, that was a wonderful story, Sophia. I had a question for the panel, okay? Based on what the testimony from our advocates, and the experience that you have, well, maybe all four of you can consider this. Do you think we ought to have free drug abuse treatment and mental health treatment in our society?
Most definitely.
Just free, just available to everybody without any restrictions?
Majority of people in their lifetime experience.
Go ahead, pull that up to your...
Many people experience a mental health crisis. It may not be as extreme as bipolar or schizophrenia, but panic attacks, numerous people experience anxiety. You have people in high levels of business, of any kind of things. Lots of people experience depression in their lifetimes. Many people will experience a mental health episode in their life, and if we destigmatize it and don't make prescriptions so crazy expensive, because once they didn't bill my medical insurance right, and they're like, oh, that's $900, I'm like, that's more than my entire income. So, I mean, drug abuse also, a lot of people at all levels, it doesn't discriminate. Drug abuse, mental illness is just another type of disease that we don't quite understand fully yet. It's a different type of brain abnormality.
Okay, other people, you have any comments?
Well, for me, I look at it like this. Will it benefit the person who is suffering this condition and all of society if they have these care available to them without cost? And I believe, yes, it would.
Okay, go ahead. Others?
Not only free, but accessible, and that's why having it in supportive housing where it's not just, say, in a clinic or someplace else, where it's really there where folks are, is also important.
Well, we have one place that's free and accessible. It's called the prison system. Okay, you know, so you're going to get all the drug treatment, you can get all the mental health treatment. We have a judge, a federal judge, that ordered the state of California to put mental health clinics and hospital in every prison in the state. We're spending millions and hundreds of millions of dollars on this. The county jail in Los Angeles is now being under court order to do the same. We're spending all this money. Do you think it's better to spend it before somebody gets to jail or prison? How has that been looked at in a policy sense? And what, how, you know, because I think if everybody says there just isn't any money, to me, there is a lot of money, but we're spending it on a lot of things because we're spending a lot of money because we're not spending money on other areas, is what it comes down to. Maybe we're spending money in the wrong area. So
let me just add to the conversation here. There are a group of us legislators who have been traveling around the world, and not around the world, but went to Portugal, who they treat alcoholism and drug abuse as a health issue, not as a criminal issue. Mm-hmm. And the same thing happens in the Scandinavian countries where there is an attitude that if people need health treatment, mental health treatment, physical health treatment, it's treated as a health issue, not as a criminal issue. So for instance, we were in Norway this last year at a high security prison, and it was they have 43 prisons in Norway, and approximate people, about 2,500 in this particular prison. High security, and you come up, it looks like an old castle. I mean, it's just 25-foot walls, etc. But there's no barbed wire on top. And you walk into the prison, and there's the only people in uniform are the guards, and they don't have guns. They don't have, they don't have any. The prisoners are wearing their street clothes, and every room has a nice window that looks outside. I mean, the idea is that yes, you've committed a crime and you're going to pay for your crime, but what you lose is your freedom. And everything else you learn in prison is about normalcy. Normalcy, how to behave in a normal manner to get along with your fellow people in a community setting. So it's very, and these people are not there for drug abuse or for mental illness. They are someplace else. But it's not to say that, and they do have terminate sentences. I mean, supposedly you can't spend more than 30 years of your life in prison, 30 years. But we did know that there was one person at least who was 81 years old, and he's still in prison, and for pedophilia. So it's a different kind of attitude about drugs and mental illness that other societies have that we are struggling to overcome. So I just, and I do know that there is, we're taking the legislature this year anyways, is taking a more serious look at this. And the governor is sort of with us, because he did not sign some bills this year that created, quote, more crimes.
Vetoed the housing bills.
Yeah, well, beside the housing, he vetoed those bills that created more crimes, and so
Yeah,
I think this is an opportunity for us to take another look about how we treat mental illness, drug and alcohol abuse.
Every person in law enforcement I talk to is very frustrated with the fact that we don't have adequate drug abuse and mental health treatment, and that the safety net allows people to fall through the safety net into the criminal justice system. And then we have to spend huge amounts of money on incarceration, legal cost, all those kind of criminal justice costs that are so expensive. I think the average person in the state prison is now $60,000 per year.
Wow.
And if they have mental health problems, it's $100,000 a year.
Mm-hmm.
So it seems like if we had a strategy to maybe use the money more efficiently before they even get to prison, that would be a more appropriate community strategy. Is have other organizations in the United States looked at this and developed some strategies? Maybe Amy, you can respond to that.
Sure. I'm happy to tell you that just this week the U.S. Interagency Council met to discuss this very issue. So trying to break the cycle between homelessness and the criminal justice system by providing alternatives that are rooted in housing and accessible and barrier-free services. In addition, looking at the link between supporting people who are re-entering the community as well as minimizing criminalization. So we have 19 federal agencies on our council, and they sat around a table to discuss this very thing. And I think that there's an openness to understanding what kind of partnerships can emerge with federal partners in states like California.
Are there, excuse me, Amy, are there any models out there? Or is any other state doing this, looking at this in a different manner?
I think that's a good question. I think that there's I mentioned puzzle pieces. I think right now there's pieces of the puzzle where states are working with law enforcement, with Department of Justice to think about how can we think about reentry in a different way, and I'd be happy to forward you information about that.
Yeah.
And I wanted to talk to Ms. Kavanaugh, because you described a pretty nimble department, and I'm just, given our experience with state agencies, et cetera, nimbleness is not the word that we would describe how we react to issues. And if homelessness in California is an issue that we've put on the table, what kind of resources, is the your Housing and Community Development Department addressing and giving you in terms of creating more partnerships or whatever you happen to need to try to address this problem?
I'm going to joke now. If I gave the impression of nimbleness, I didn't mean to, because state bureaucracies are bureaucracies and large organizations, and we administer programs that typically are not real flexible or flexibly applied to different local situations. So I think that is a real challenge of state administered programs. And so to the extent we can increase the partnership and the flexibility and put the money in the proven solutions, I believe, and in the local situation, then we'll be more successful. In terms of money to do that weaving of interagency, really we are just nibbling around the edges. It's not directly funded. And It can have a lot of payoff, and so we are keeping at it. But it's not something that, it needs a sustained effort, yes.
Well, I would agree. So how do we make it more flexible, or how do we kind of blow it up, so to speak?
Well, I think some of the program models I talked about are trying to do that. We're trying to do that within some of the programs, such as the Veterans Program, the ESG program. We are collaborating with the health agencies, so I think the health housing conversation, which includes then the services related to mental health and substance abuse is really key. So working with the health agencies and having them also work with the locals and other partners through these amendments, through the 1115 waiver and the health homes is another way. I'm not sure I have a really, slick answer for you, but I think it's that kind of work that will give us something other than just a program delivered without the flexibility or nimbleness or.
Well, I know these are very difficult issues, and Senator, and we are pretty simpatico in terms of identifying the issues, but I feel like at the state level we have a long way to go to be a significant partner in this, unless we come up with resources.
I'm a member of the. I'm appointed by the Senate to represent the Senate on the Mental Health Services Act Commission. The Mental Health Services Act is Proposition 63, and the commission allocates money statewide, and then each county develops a plan for how the money for their county is spent. Okay, and they have a stakeholder group process to do that. Since the act was passed by the voters, Proposition 63, there's been a lot of changes to health care, mental health, in terms of requiring insurance companies to provide full coverage. The Medi-Cal system is supposed to have coverage, and this issue of focusing on mental illness and support services like you had, one of the question is, I'm thinking about working with mental health advocates to introduce legislation to transfer or repurpose some of that money to housing programs for mental health purposes, as a strategy to reduce serious mental illness. I want to know what your reaction to that is. Is that a strategy people would support? It's a very specific question, but I'm generally thinking about this, talking to people like former Senator Darrell Steinberg and other people that are advocates of mental illness issues.
The easier the access and the more trusted the staff, as at the Downtown Women's Center, we have a psychiatrist, and we also have counselors or therapists there. When you can walk out your door and actually have the services right there, it makes it so easy to receive their services.
Wrap around.
Yeah, it's just it's absolutely incredible for supportive services.
Okay. Yeah, go ahead.
The more accessible mental health services are, the more likely people are to use them.
Yes, thank you. Thank you.
I think changing the purpose of the funds is a very complex question. So other people in the room really more equipped to answer what's happening from the state level. MHSA has played for services has played a very important role in the housing. So I don't know the state of the Affordable Care Act taking up those services, and I think other people maybe in the later panel will have more direct experience, but it has been very key. Those services have been very key for permanent supportive housing.
Well, I think one of the things with healthcare for mental illness is that traditionally, until recently, mental health has been like a segregated healthcare system. And we, in the Affordable Care Act and the new Medi-Cal waiver, we have been over the last 2 or 3 years proposing making it integrated with your regular medical care. So it's all tied, integrated together, and not some kind of like segregated thing you have to go to the county for, or some special separate program. It's all integrated into one system. And by integrating it produces better healthcare outcomes. I'm the chairman of the Senate Select Committee on Mental Health. So I focus on mental health and substance abuse. And the goal for that committee is to reduce mental illness by making it integrated into the regular healthcare systems. So that's Proposition 63 was passed when the system of mental health was segregated. So there's been an evolution that's taken place. It's not totally there yet, or it's not perfect by any means. I don't suggest that. But at the same time, there's been changes that have happened. So we're looking at this idea. So I wanted to know what you thought of that.
I think
there'll be other panels that can respond to this question too. So.
Not only would it help probably the healthcare outcomes, but also that stigma between mental illness and the health issues. That separation in itself creates a stigma. So to integrate it into health system and treat it like any other health problem, I think would be a great thing.
I think Patrick Kennedy, he always says the healthcare system used to be from the head down. We got to make it from the top of the head down to the toes. We can't have the head as a separate from the regular healthcare system. So we have to integrate it and make it a part of a routine, and that would, like you say, reduce sort of stigma and those kinds of, treating it as a social disorder or even a criminal disorder in some people's minds. So we want to kind of create it as another health problem that needs to be addressed in just the everyday life of people. So I thank you. Is there a question, Sean? Okay, I thank you very much for being here. Thank you. We'll focus on the next panel now and invite them to come forward. And we're going to talk about economics and cost. And Daniel Fleming is going to present. Daniel, welcome. And thank you for coming and talking about, I guess, the dreary science of economics, but it's so important. Makes the world go round.
Thanks for inviting me.
Thank you.
It's a pleasure to be here. My name's Dan Fleming. I'm from the Economic Roundtable. We're a urban research group. We've done studies in Los Angeles County and in Santa Clara County where we've linked records of people who've been homeless across all of the public agencies and the nonprofit agencies to get a handle on total costs. And I'd like to talk about two pieces of that. The issue of the most disabled, chronically homeless folks, and then the issue of prevention and how we use resources to do this. So our work in Los Angeles County, we looked at the cost distribution among people who were homeless, And the most expensive 10% had average costs of about $67,000, $68,000 a year. And then we looked at the same people when they were housed, and the costs were about $19,000 a year. So this led to interest in, well, who are these people? How do we find them? Let's house them. And we've worked with a variety of partners in that, and there are programs underway that are doing this, and we're doing similar work in Santa Clara County. So the savings out of that are $47,000, $48,000 a year. If you take out $15,000 to $17,000 for housing, there's still very substantial public savings out of this. The difficulty is that the linchpin of the whole thing is housing. You know, none of this works unless you can give someone housing that's permanently affordable to them. Despite very substantial public savings, it's hard to make this money fungible. It's hard to move money from jails, from mental health, as you just suggested, or health, into housing. The county health department is doing some remarkable things, but by and large, it's very hard to make this money fungible. Section 8 vouchers are the main resource. They've dwindled. It's getting much, much harder to get those vouchers for homeless individuals, regardless of their level of need. We've eliminated...
by the people too.
Right.
Yeah, the people get them and they can't lose them.
That's right. But getting them in the first place, I mean, we have a waiting list for the general public of over 11 years in Los Angeles. We have something like 500,000 people who are eligible. So we have just we have very large numbers of people who need housing. And the inventory of Section 8 vouchers is shrinking. We don't have redevelopment agencies. We've had a very bad recession, so local government and state government money for affordable housing has dwindled. So the reality is, when you cut through all of this, we have an extraordinary shortage of resources from every level of government for affordable housing. We all, at every level, need to find a way to put more money into that kitty. So these most acutely disabled people are one of the areas of low-hanging fruit. But I think when we look around us today, it's becoming apparent that we really can't house our way out of this problem. Housing is crucial, but despite our efforts, we are seeing more chronically homeless people. To reiterate the statistic that Greg quoted, there are, on a given day in LA County, about 500,000 people in poverty paying 90% or more of their income for rent. 43% of those people are children. What's astounding is we don't have more homelessness. When we had a project where we looked at 942,000 LA County public assistance recipients who had experienced homelessness, and out of that population, about 13,000 a month entered homelessness. That includes couch surfing, so it's the HUD definition plus the McKinney-Venta definition. But there are just a lot of people who lose a place of their own to live every month. We recently did a project in Santa Clara County where we assembled 6 years of data for everybody in the county who'd experienced homelessness. And that's been very informative to us because it really makes quite clear that most people make it out of homelessness with very little help. When we look at these folks in Santa Clara County who've experienced homelessness, on a given day, about 83% are not homeless. Folks who've been homeless over 6 years. 10% or so are maybe in a short episode of homelessness, and 13% are chronically homeless. So what it suggests is that if we can just push these margins a little bit, if we can help people more effectively before so much wreckage accumulates, we can, at the end of the day, have less chronic homelessness. So we've looked at that in Los Angeles County. Our estimate is that for about 70% of people who have an experience of homelessness, the way out of the woods is getting a job. And so, but if we look around us, we really don't have very many good employment programs for homeless folks. So that's the ways out of homelessness are either getting a job, getting your family to take care of you, getting SSI, or dying. So by far the most desirable and the most feasible is work. We ought to be doing better at that. Temporary but deeply subsidized housing probably works as needed for about 10%. We probably have that for about 1% of the folks. SSI benefits are a good solution for disabled folks. I think we're getting about half the people who are eligible connected. Permanent supportive housing is maybe a solution for about 10% of people. We maybe have slots for about 2% of people. So we have shortfalls in every category. But again, returning to the public assistance population in Los Angeles County, we have a long enough time. We're looking at a 9-year time window on folks. And so we're able to track people who experienced homelessness as children and as teenagers into adult years. And what you see out of this is that experiencing homelessness as a child is a very powerful predictor of homelessness and disabilities as an adult. So another of our recommendations has been that we become much more effective at breaking down silos, and that we use resources from the Affordable Care Act for folks, particularly children, and that we establish tripwires. And if a family experiences homelessness, if a family experiences prolonged unemployment or domestic violence, or kids aren't going to school, that those be tripwires for connecting that family with mental health services, with medical care for kids if they have disabilities, substance abuse services, send a visiting nurse to the home, that we be much more nimble or agile in connecting the resources that we now have under the Affordable Care Act with the needs of kids, and prevent this blossoming of disabilities and unemployment that we see among children who've experienced homelessness when they become adults. So thank you for the chance to be here today and make comments.
Yeah, I had a question. Which groups were the most expensive, if you want to put it that way, in terms of cost, when you started looking into it?
Well, the typical person in this most expensive, this $67,000, $70,000 a year category, there's a lot of paths into it. The most typical individual would be a man in his late 40s who has severe mental illness, probably substance abuse issues, and also a chronic health condition. Being young and having schizophrenia and having issues where you act out in public and wind up in jail, mental health incarceration will also get you there. There are various paths into that group, but usually it's folks who have accumulated a lot of wreckage, whose problems have gotten worse over time. They've been in jail typically, they've been in hospitals quite a bit typically, and the solutions that have been offered to them have been short-term and they haven't stuck.
Okay. The healthcare needs of somebody like that, schizophrenia, it is by California law for the last 18 years under the mental health laws of the state, requires both Medi-Cal and all healthcare insurance to fully cover schizophrenia. Fully cover. I mean, you know, fully cover means whatever the doctor feels that patient needs in terms of care, including, you know, treatment in a residential facility, the whole gamut of options for care. So can you address that in terms of, like, people are people just saying they walk away from the care, or how do we connect people better with those kinds of issues, you know, to provide them with care? What is the best method?
Well, what we see in the people who have these very high costs is that there are crises again and again and again in their lives that bring them to expensive settings, either to a jail or a hospital. And housing stabilizes folks, and those crises subside and costs go way down. When the programs that we've partnered with go into hospitals and offer people a place of their own to live, about 95% accept it. So there's a very small number of people that maybe have some business out in the street they want to deal with right away. Maybe they have some paranoia about the offer, but overwhelmingly, if people are offered a place of their own to live, they accept it. I would also say that we've recently looked at OSHPAD data for the state and looked at people with who are both homeless and have a diagnosis of schizophrenia, and find a preponderance of people discharged back to the streets. So these resources and these
Medical institutions?
No. Yep, yes, from hospitals. So discharged from hospitals to the streets. So
under law, they can be assigned to residential care by the hospital.
Well, I think we have an educational challenge to let
That's the law.
Yeah.
That's, you know, under the Affordable Care Act and the mental health parity laws, they can be put into with medical coverage into a residential treatment.
I don't think we're making use of that resource from what we're seeing in the data. So I think that's something that's an area where we maybe could do something.
Yeah, okay. Can you address other special needs groups? Like we had some witnesses here earlier about one of which had foster care, was in the foster care system. The foster care system now, she mentioned 18, that was probably when she was in the system, but we have a new law in California, AB 12, that allows the system to care for people to age 21. And then also the transitional housing support, and the foster care system will take care of somebody until age 21.
Yes, I've been a foster parent. We're involved with foster kids, so just from firsthand experience, it's hard to get traction in life when your family has failed you and when you've become society's child.
Yes.
And I was at a meeting in Pasadena last night where we were hearing about a number of homeless foster youth in Pasadena Community College. So hearing about homeless, so we absolutely need to be doing better for these kids, particularly I think doing better at offering them paid internships so that they get some traction in the labor market.
Yeah.
That's, if you help pay somebody's salary, that's a pretty good way of getting them into a job, and making more paid internships available would certainly be helpful. Extending the same help to kids in probation, because the kids aging out of probation and the kids aging out of foster care look alike. And
we had a look-alike bill this year that failed. We failed to get it passed. It was SB 12, and it failed to get out of the Assembly. It got out of the Senate, but did not get out of the Assembly.
Yeah.
We're going to look at. We'll try again next year. AB 12, SB 12. We put 12 because my original bill, AB 12, the bill that extended the age to 21, we kept using the number 12 in all our bills. So when they see 12, that's the foster care bill. Okay, so we you know, between the two senators here, I think the bulk of the foster care bills between Senator Lieu and myself were the ones that introduced those bills, and Senator Mitchell.
Well, people who are involved with foster kids really appreciate your efforts, so thank you.
Yeah. Okay, well, thank you very much, Daniel, and I appreciate the study, and it really shows that housing stabilizes the population of homeless and saves money.
Yes.
Saves money. Okay, thank you. Okay, we'll go on to our next panel. And this is the last panel. We have 3 people here. And Sharon Rappaport is from the Corporation of Supportive Housing, which we heard about earlier. Christine Margiotta is from United Way, Los Angeles. And Mark Trotz is from LA County, Director of Housing for Health. Okay, yeah. You want to take that? And you, some of you have to leave early, so whoever has to leave early can go first, or you guys can figure that out. But some people have to leave, so. And then we'll open it up for public comments. Okay. Thank you.
I'm going to take Daniel's.
Thanks. Okay. Okay.
Good morning.
Hi, Mark.
Thank you for having us. And yeah, I kind of messed up on the schedule a little bit, so I was the one who has to leave. But fortunately, I'm going to spend the afternoon with you walking around Skid Row.
Yes.
So we'll have more time. I think I'm going to try to just hit upon about 3 things. Maybe one small little rant for a very short period of time. Secondly, what we're doing in the county of LA, and what we're doing specifically in the health department. I'm with the Department of Health Services, and I run a group called Housing for Health. And a lot of what was just touched upon in terms of the reallocation of funds and so forth is what we're doing. But in general, I'm sure you participate in many hearings like this where there's extreme disparity. And I just want to encourage you, and it sounds like from your remarks so far, there's really no encouragement for you, but maybe it's your colleagues, that there are very serious other disparities in education, in criminal justice, in other areas, and there's a lot of demand for state funds. But I really think this issue falls into a category by itself, and it's not about a crumbling road system or aqueducts and so forth.
On that yesterday.
Yeah, boring, right?
But I heard the thing about jobs, so my brain's clicking.
Yeah, there you go.
Okay, and then we can
There would be a relationship there.
people doing their maintenance.
Absolutely.
That's part of it.
Absolutely. But living downtown and working in Skid Row, and what you'll see this afternoon with us, I know you'll feel that it's a completely different issue, and homelessness and not having a place to live is so foundational. I really think that we do have to look at it differently. And it flies so in the face of what we stand for, all of us here, and what this country is supposed to stand for, that we really have to do something different. And it can't be just serial hearings and other things where we glaze over on all the acronyms and go on to the next hearing. I mean, we literally have 45,000 brothers and sisters in Los Angeles with no place to live. And 20,000 of them literally on the street, and 3,000 of them literally right here. And the contrast is just heartbreaking. Even just driving over from my office today, I saw a man in his boxer shorts with no shirt on, a block from my office, scratching himself erratically. And we can do better than that. California can do better than that, and Los Angeles can do better than that. So we want to partner with you, and it is about the resources, and I know you have constraints on that, but surely there are some there, and there is reallocation possibilities. But it's also about the systems and the leadership and the moral outrage and so forth, which if we put all of that together, in 5 years from now, we should be at a different place. So the other part I want to hit on is the county, through our esteemed colleague Phil Ansell, now in the CEO's office, is leading a planning effort to try to pull together the best ideas on homelessness within the county family. And doing that in conjunction, Greg mentioned this earlier, with the city and with Home for Good. So I think the city and the county and our philanthropic partners are dead serious now about solving this issue, which is really heartening. You'll see some, concern for everybody trying to outdo one another. Well, I say bring it on. We should be outdoing one another, and I don't see that as a problem. Obviously, we don't want to be discoordinated and throwing money around like crazy, but if Mayor Garcetti wants to do $100 million, and then Supervisor Mark Ridley Thomas wants to do another $100 million, and then X official wants to do another, and so forth, that's what we need, and that's what we should be doing. So I'm very encouraged by these various planning efforts that are going to dovetail. And on the local level, it really is the city and the county that have very important powers to ending homelessness. On the city side, it's land use and streets and policing, and on the county side, by and large, it's healthcare and income through DPSS and other sources. And those, as we've been talking about, along with the housing, are really the tools that will end homelessness. And so now I'm going to just step back one further and just tell you a little bit about what we're doing in Housing for Health. You may know Dr. Katz came down from San Francisco to lead the health system down here, and I followed him about a couple years later. We worked together for a long time in San Francisco. And he's the type of leader who believes by and large, there are the resources to do this. And if we work and think smarter, we can get something done. So this applies to all sectors. I'm giving a health example right now on this, but we all see the insane use of resources in the health system when you don't do something reasonable for homeless people. They show up in our medical campuses day after day, and left to the sort of normal treatment of homeless people, we'll see them, year in and year out, and they will die in their late 50s and early 60s. That's essentially the sad truth of our current predominant state, I would say, in the nation on this. And Dr. Katz is just not willing to accept that, and that's why he decided to use a meaningful part of his $4 billion budget to start developing housing. And if he was here talking to you, he would say, as a physician, which he currently still practices and goes to a clinic every once a week, the most important prescription he can prescribe a homeless person is housing. He can give them all the pills and all the other things and so forth, but if they don't have a place to live, it doesn't add up to a hill of beans. And that goes to employment, to reunification, and to all the other things. So at Housing for Health,
I've known him for a long time.
Good.
I'm aware of his strong public health approach.
Yeah. So he's, we're really trying to take this to a really large scale, and Dr. Katz's other thing was, well, now we're in LA, whatever we did in San Francisco, we have to do like tenfold here, given the scale of what we have. And so our goal is to create 10,000 units of housing linked to the health system. By June of next year, we'll have done 2,500 of those. And we're taking an any and all approach to doing it. So you'll hear people very passionate about one form of housing or one form of assistance and the other. I, from my experience in doing this work, believe that there's 100 ways to house a homeless person and help them. And those exits and those options exist, and it has to do with our tenacity and our willingness to make that happen. And the principle, I know this morning we heard a lot about various different programs, and they're all wonderful, and in many ways you could distill much of what we've been talking about into two broad categories. One is the supports for housing, so a rent subsidy of some type, and support services, which is also like caring and love. And you put those two things together, and 95% of the people, or 99.5% of the people out there can remain housed. So one thing LA County has done is created a new housing pool, and it's called the Flexible Housing Subsidy Pool. We started with $18 million, and it's growing. And it's a local subsidy in reaction to the plain truth that there's not enough federal Section 8s and other subsidies to get the job done. And we basically decided that we can either sit around, these tables and others whining about the lack of federal resources, which we should do, but in the meantime, we're the ones, the local governments are the ones feeling the pain with our fellow human beings lying on our streets. So we put together our own rent subsidy program, and we're really understanding, without all the barriers and all of the bureaucracy associated with many programs, how essentially easy it is to help someone. If you can have a unit and you can subsidize their rent and you can offer them intensive case management, it works. And so I just want to, reiterate that, or just bring that to light, that, and we're not the only ones doing this in the county or the nation, but it's just that the actual solutions are quite workable, and they're happening every day in many places in Los Angeles and the rest of the state. And I just, want to caution us for getting overly complex about what it takes to end this situation. And I very much look forward to walking with you and talking with you and showing you a couple examples later today. Yeah.
Okay. Steve's next.
Great. Good morning, Senators. Thank you so much for having us and for pulling together this forum this morning. I'm Christine Margiata. I'm with United Way of Greater Los Angeles, and wanted to share a bit about some of the tremendous work that's been happening in LA over the last 5 years or so. And just want to especially appreciate you for starting the hearing this morning grounded in the experience of people who have experienced homelessness. I turned to Mark after Vicky and Sophia spoke and said, I don't think there's much more to say than that. Their experiences are such a testament to both why this is so urgent, but also, to Mark's point, how simple the solution is when we really look at this housing as that most immediate intervention and the support wrapped around that once a person is in housing was just stated so eloquently and brought the humanity to the conversation. So I will add what I can, but I was just struck by how beautifully that captured what both the state of things and what we need. So I'll share a bit about Home for Good, which has been mentioned. It was initiated as a partnership of United Way and the Chamber of Commerce here in LA, but was intended and has grown to be a collaboration across all sectors. The public sector, nonprofit, philanthropy, the business community, our elected leaders, looking at how do we all come together around solutions. We've now grown to over 200 leaders and organizations who are a part of this effort. And we really had two major focus areas when we started. One was to speak to the solutions. We know what works. We know what ends homelessness. This isn't one of those issues where we're stumped about what we need to do. We know that the solution to housing is to scale, the solution to homelessness is to scale housing and housing first, and to create a system that can quickly link people to housing and supportive services. And the other piece was then to look at what are the resources it takes to get there. So how do we what local, state, and federal resources do we need to truly scale the solution, and how do we create the public-private partnerships needed to support that? So we're about 5 years into Home for Good, to this partnership. When we started, our intention was to create an initiative that would end all homelessness, starting with a focus on chronic homelessness and veteran homelessness. And when we started in 2011, there were 7,000 veterans out on the streets and an additional 10,000 chronically homeless people. So 17,000 people was the universe of folks out on the streets that we were focused on starting with. So I can say today, 5 years later, that community of 200 organizations and entities has housed 23,000 people. So you would think we started with 17,000, they're now 23,000 people housed. You would think our work was done, right? 23,000, started with 17, we housed 5,000 people who we didn't even know were out there when we started. But I think to Greg's point early in the hearing, we've learned a tremendous amount in those last 5 years. So I want to share the three big things that we've learned, and the first of which is the tremendous number of people who are becoming homeless here in LA County. So again, housing 23,000 people should have ended veteran homelessness, should have ended chronic homelessness about a year ago, had that been a stable population of people sleeping out on our streets. You look at veteran homelessness alone, there were 7,000 vets when we began. 14,000 have been housed over the last 5 years. We started with 7,000, 14,000 housed. As Greg mentioned, we see about 4 or 5 veterans becoming homeless every day in the city alone, another 8 to 10 across the county. That's a rising tide. That's an incredible challenge, and one that the homeless services system can't solve alone. So many have mentioned today the need for affordable housing, and we appreciate your leadership and eye towards that affordable housing, looking at the tremendous rent burden that people across LA who are housed but right on the brink of homelessness. An eye towards affordable housing is so critical to help stem that tide of homelessness. So that's the first major learning that we've had, and we now have an increased focus on that affordable housing piece. The second piece, as we looked at solutions, we realized it wasn't enough to just say housing is the answer. We need more housing, and we need to connect people to that housing. What we learned is that we needed a system that could comprehensively connect people to that housing. So you've heard reference to the coordinated entry system today, and what I'll say is it's likely what most people would assume was already happening to address homelessness. It's a very straightforward, sensical approach to this that basically seeks to know every single person who's out on the streets, understand what their needs are, and then link them to the right fit permanent housing and services to meet those needs. So you would assume that just makes sense. You would assume that's how we've always been doing it. To give you a picture of what it looked like before, there are hundreds of fantastic nonprofit organizations throughout LA County who are working every day to house people who are sleeping on our streets. And they, by necessity, were doing so each as their own organization for the most part. So they would open a new building of permanent supportive housing. They would have 50 units become available. And the only approach available to them was to say, we will take applications on Friday morning at 9 a.m. The first 100 people who show up will be able to submit an application. And you can just imagine what happens in a dynamic like that, in an environment of that kind of scarcity, where people have been out on the streets for decades. The thought of making it to the front of that line is so daunting that many people stopped trying. People would get kicked out of line or bullied out of line. So there were those fortunate 100 people who would get to submit their application, but there were thousands and thousands of others who didn't even know the line existed, or who gave up long ago in trying to fight their way to the front of it. So that's a sense of the before and after. So the coordinated entry system seeks to make sense of that process and democratize that process, so that, one, there is no line that someone has to come stand in, that the gold standard is that every single person out on the street is known, their humanity, their story is known, and that they are, that we as a system are looking at, okay, now what are the resources we need to help support each individual person, but also take that big picture look to say what's missing. If we have 44,000 people who are homeless across the county, we know this many people can do very well with rapid rehousing, this many can do well with permanent supportive housing, et cetera. That allows us in moments like this where we have this tremendous political will. Mark mentioned the dueling $100 million in our city and county. In moments like this, we can say, we know this population better than we ever have before. Here's what we need to solve this. And we want to say the same to our state and federal leaders as well, to say, here's our understanding of what the needs are. So coordinated entry has been really groundbreaking for this community, and I'll say it was, the intentional philosophy was that the system be built from the ground up. So contrary to many systems that you see out there, it wasn't created in a boardroom or a few people sketching something out based on doing great research. It was built by outreach workers and case managers and people who are on the ground every day doing this work, designing the system from the ground up, and then policymakers coming around the table and asking, how can we support you from the top down? So it was an incredible process to be a part of that creation and to see what a unique system has come out of that, and the effectiveness of it. We certainly still have a long way to go in improving it, but also the support you see across this community for this system is incredibly powerful. The third thing I'll say, the last thing I'll say we learned in the last 5 years is about resources and the effectiveness of resources. So this probably won't come as a surprise, and I imagine everyone who's in front of you on any given issue talks about the power of resources. I will say 5 years ago, my mantra was that we had everything we needed in Los Angeles. I looked out at a community this wealthy, and I said, there's no way that we can't solve this with what we've got. Dan Fleming had a fantastic research study that showed the incredible amount of public funds that we were spending managing homelessness every year. And we looked at that and said, we have to be able to redirect those resources. And over the last 5 years, our public systems have done that in huge ways. I think the Department of Health Services is a great testament to that, of how do we repurpose public dollars towards the greatest impact. And what I will humbly say today is that it's not enough. What we have now takes us a long way. It's housed 23,000 people, which is incredible, but it's not enough. And I think what we've seen on veteran homelessness, as Amy mentioned earlier, is such a testament to that. You mentioned at the opening of the hearing that homelessness has risen in LA County, and it's risen for every single population other than our veterans. We've seen veteran homelessness go down 39% in the last 5 years. It's the only population we've seen a decrease in, and it is not coincidental that that's the one area where we've seen tremendous resources poured in from every level, particularly the huge federal investment of resources for veterans, but state resources, local resources. So again, it gives me that hope that, one, we know the solution is housing, and two, we see when we invest the resources in it from every level, we make the progress needed. So I'll just echo, as Mark said, we are here as your partners. We're so grateful to both of you for your leadership on this issue, both around criminalization, around what people are experiencing out on the streets right now, and your advocacy for solutions for housing and integrated services at scale. So thank you for having us.
Thank you.
Good morning. I will be kind of repetitive in some of the things that I say, so I apologize ahead of time, but I'm Sharon Rapport. I'm with the Corporation for Supportive Housing. I work on policy in California. CSH is a national nonprofit that advances housing solutions to improve the lives of vulnerable people. And we do believe completely that homelessness is solvable, like the other panelists that you've had up here today. And so, like I said, I probably will be a little bit repetitive, but I did just want to walk through some of the terms you've heard today and the solutions that we think could make a huge dent in homelessness in California. So I'm not going to just talk about Los Angeles, but California as a whole, because I mostly work on state policy. And I will talk about some legislative solutions. So, most people really do not need supportive housing. You've heard a lot about supportive housing, and clearly from the Corporation for Supportive Housing perspective, supportive housing is an evidence-based model that has amazing outcomes, and you heard from the two community advocates who were here today how it really does turn lives around. But the fact is that about 70% of Californians need what we refer to as rapid rehousing, which is really services to help people find an affordable place to live, a short and medium-term rental assistance, short-term case management, and to help with things like security deposits and back utility payments, whatever that individual or family needs to get into an affordable permanent place to live is what rapid rehousing is about. And it is showing some really good early successes. It's a relatively new approach, but we think it's a approach that's worth pursuing. And it actually requires a pretty small intervention. It's not nearly as expensive as supportive housing. And I think it's important to talk about rapid rehousing simply because supportive housing as a much more expensive intervention is not necessary for everybody, and we really do need to prioritize the most vulnerable populations for supportive housing. About 1/3 of Californians do need supportive housing, and these are people who are chronically homeless, people who are cycling between institutional settings and homelessness. You talked about people in prisons. Lots of times they're not necessarily considered chronically homeless if they've had time in prison or jail. That's been long enough, and they exit prison to homelessness. We see huge numbers of people exiting incarceration to homelessness. And other institutional settings are similar, hospitals, nursing homes. So those people often need supportive housing as well. And then there are other people who have other significant barriers to housing stability, and they do need not only long-term rental assistance, but the services that promote housing stability and keep them stably housed. So behind either of these interventions, rapid rehousing and supportive housing, we know affordable housing is the basis, available affordable housing is the basis for making those interventions work. And you've heard a lot about that today already. But I would just say that the affordable housing we're talking about is really housing that's targeted to people who are living in deep poverty, not people who are at moderate incomes or even people considered to be low income, but people who are really struggling with paying 90% of their incomes on rent, and even people paying above 50% of their incomes on rent. If they're living in poverty or deep poverty, those are the people who are living in overcrowded housing or substandard conditions now in California because they have no other choice. They cannot find housing that's affordable to them. And that's true across California in every county. So sometimes our affordable housing approaches spend a lot of our affordable housing resources on those people who need affordable places to live as well, but are not susceptible to becoming homeless without it. So if we really want to prioritize our affordable housing resources, we really should be prioritizing those resources to people at the greatest risk of homelessness. I also wanted to mention that services is also needs resources, and we are hopeful that there are some activities going on right now with the Department of Healthcare Services that will eventually fund some of the services that we've been talking about today. I think Cindy Kavanaugh mentioned health homes and the 1115 waiver. Both of those offer the promise of services that help not only coordinate housing and health care, but also that help integrate care. And I know that was some of the questions that you asked earlier today could be addressed if we had the level of services that we needed through Medi-Cal as a sustainable entitlement benefit, that we could just build up the resources to coordinate somebody's care, to get them into and connected to substance use and mental health benefits that they're entitled to already, but that they're not getting because it's not accessible. And I think Vicki mentioned the case management services that that helped her really turn her life around, really helping her fill out those housing applications, helping her find places that had openings for her to move into. Those services right now are not funded at any sustainable level, and they could be through these opportunities that exist. So we know that the resources to pay for these interventions currently don't exist, but that, as Christine Margiota said, it could make a huge difference. As she mentioned, we've seen in California big decreases in homelessness among veterans. In California, it's been about 30% decrease between 2009 and 2014, simply because of those federal resources that were available and a focus on ending veteran homelessness. And conversely, we know resources or a lack of resources have really allowed homelessness to increase, and we will see an increase this year statewide. We're seeing increases in every major city in California and on the West Coast as a whole, simply because resources have decreased. We've seen 40% cuts in federal funding for housing programs, 90% cuts in state programs for rental assistance and development programs. And that will lead to what we're going to see soon is not just increases here in LA, but increases statewide in homelessness. And I noticed that the policy brief had talked about significant severe cuts to housing programs back in the late 70s and 80s. And that really did precipitate the first really explosion in the numbers of homeless people that we saw in the 80s. So resources do make a difference, as several people have said. And I just wanted to mention, too, that we do think that the legislative solutions to make a big dent in ending homelessness in California have been proposed. A lot of the solutions have been proposed or are pending now. And I think if we can, as Mark said, really get your colleagues to prioritize this issue and see it as a real crisis, an enduring crisis, but one that's increasing because of our lack of resources or our cuts to resources, then maybe that could create the political will to really have an impact. One example is the legislature could pass and the governor could sign AB 1335. That would create $500 million through a permanent source of funding for Affordable Housing Trust Fund. That bill would create 10,000 jobs every year through that funding. So you mentioned creating new jobs, and that it would be a job creator because it would create 10,000 units of new housing that would be affordable. If that money dedicates at least 2/3 to people who are living in poverty, building affordable housing for those living in poverty and for those experiencing homelessness, then it would have the greatest impact, in my opinion. We are hoping 2016 could allow for a legislative fix to the Palmer decision. The Palmer decision involved a judge incorrectly, in my opinion, ruling that the LA inclusionary ordinance was a violation of the Costa-Hawkins Act. Speaker Atkins had introduced legislation to clarify that inclusionary zoning ordinances are not a violation of that act. And unfortunately, that bill was vetoed in 2013 because the governor said he was waiting for a Supreme Court decision on inclusionary zoning for home ownership programs. That decision was reached this year, and we really are hoping. Yes, that's right, in Santa Clara County. You're absolutely right. So we are hoping that that bill could be reintroduced in 2016 and hopefully get the governor's signature, because we know inclusionary works. It's worked in many cities across California, and before that case, inclusionary was one of the best tools that cities had to really not only integrate communities for those often excluded from middle class or more affluent communities, but that it also creates affordable housing. And some cities choose to use in lieu of fees or linkage fees. Those types of programs also work really well to create greater resources at the local level. This year, Speaker Atkins and Assemblymember Chu introduced and succeeded in passing AB 35 to increase state low-income housing tax credits. And Senator Bell, you introduced SB 377 to make those credits more effective. And unfortunately, the governor vetoed both those bills last week, but he indicated in his veto message that they could potentially be introduced as a budget item, and that could survive his blue pencil if the budget achieved the balance that he seeks. So I'm hoping that those items could be introduced as budget items. They could, again, make a real difference. And they are really excellent policy.
We're working with the treasurer, John Chung, and he's helped us a lot of those.
Oh, good. That's excellent to hear. I do think that state housing tax credits are one of those untapped resources. We could be bringing hundreds of millions more dollars back to California from the federal government and just being able to tap into their tax credit system more effectively. The legislature could also pass other budget items to fund rapid rehousing and supportive housing interventions. An example of that, you were talking about the foster care system earlier. CSH and Housing California promoted a budget item this year. It was $10 million for what we called Bringing Families Home. And that was a proposal that would match county funding for providing housing interventions for families who were experiencing homelessness and child welfare involvement. We know that even though homelessness by itself is not a basis for taking a child away from a family and putting them into foster care, homelessness is the greatest predictor of whether a family will become involved with the child welfare system. Also, families cannot reunify with kids in foster care if they do not have a stable, safe place to call home. And so about 30% of all families in the, with kids in the foster care system right now cannot reunify with their families because they do not have a safe place to live. And so this $10 million we felt was a very modest investment in just trying to partner with local government to try and make a dent in homelessness among those child welfare involved families. We will be pursuing that item again this year. It actually did pass both the Senate and Assembly budget committees. Unfortunately, it didn't land in the final budget. Similarly, the state could encourage counties to redirect some of their child welfare funds to address a growing number of unaccompanied homeless children and young adults. That is becoming an increasing problem in California. Dan Fleming mentioned just the rate of children who are living in those households who are paying 90% of their incomes on rent. And a lot of those families with children are increasingly becoming homeless, and some of those kids end up on their own without any family support. So California has the largest rate of unaccompanied children and young adults who are homeless, and we'd like to see that trend reversed. Though adding resources to California is, in my opinion, the most critical thing that the state could do, the state can also act to spur and support community efforts to innovate. An example is the program that Christine Margiotta mentioned, Coordinated Entry System. LA is leading the effort on that nationally. We don't see any other communities in LA, in the nation, as advanced as Los Angeles is in the establishment of coordinated assessment and entry systems. In California, a lot of communities, they're required now by HUD to create those systems, but they're struggling to create the systems because HUD doesn't pay communities anything to create those systems. We're very lucky that we had United Way here and our LA Homeless Services Authority and Business Leaders Task Force to create that system. But the fact is that many communities need additional resources to do a good job, be thoughtful in creating those systems. So the state could provide some seed funding to communities to help them create those systems, which we think will make money go much further at the local level. The state could provide, as I mentioned, some seed money for those efforts, as well as other efforts, other innovations, healthcare innovations like have happened in Los Angeles County and elsewhere. We look forward to continuing to work with Cindy Kavanaugh on greater collaboration between state agencies, and we do think there is a lot more work to be done in that effort. We do greatly appreciate the work that HCD has done, and they've done a lot of work to engage the Department of Healthcare Services. We would also like to see California Corrections System, CDCR, really engage in those collaborative efforts as well. We think they have a long way to go to really even understand the solutions to homelessness, and as I mentioned before, there is this great overlap between recidivism, incarceration, and homelessness. So we look forward to working on those efforts with you. Also, we do think the housing agencies could coordinate funding so that funding applications are more unified, have the same requirements. If a developer is requesting funding under the Tax Credit Allocation Committee, they should also be following the same requirements that are in place for the VHHP program, for other housing programs that have been mentioned today. Finally, I think the state, we've taken some small steps in introducing legislation. We really appreciate Senator Liu's legislation, the Right to Rest Act, and Assemblymember Chu had introduced legislation around prohibiting punishing people for sleeping in vehicles. We really appreciate those steps, and we're hoping that those types of measures can pass in the near term, hopefully in 2016. We do know that punishing people for sleeping on the street, sleeping in vehicles, or doing other things that homeless people have no choice but to do just perpetuates a cycle of incarceration, homelessness, and barriers to entering housing. So again, I would say that homelessness in California is unfortunately an enduring and increasing crisis, and we're hoping that the legislature and the governor can more and more treat it as a crisis and really take steps to chip away at it. We are concerned that a lot of legislators see the numbers and get overwhelmed by the crisis that it is, and we're hoping that instead of getting overwhelmed, they start to understand these solutions a bit better. So thank you again for having the hearing, and we look forward to addressing questions.
Thank you very much. Well, thank you very much. We appreciate it. Do you think that repurposing Department of Corrections funds to housing in some way for supportive housing would be something we should look into?
Yes, absolutely. We actually, in 2007, CSH and Housing California succeeded in passing a small amount of money of CDCR funds to create a supportive housing program for mentally ill parolees who were exiting prison or were in the community already as parolees. And unfortunately, that money never was spent in a way that we would like it to be spent. It's called the Integrated Services for Mentally Ill Parolees Program. Legislation was actually passed years later to try and direct CDCR on how to spend that money, and unfortunately it just has not been spent the way we'd like to see it spent. It's been spent more on transitional housing programs that haven't been as effective, or day centers or group homes, and so we don't think that those are the solutions to homelessness, and we're hoping that eventually we can get CDCR just to allocate that very small program in for the right things. But there are other sources of CDCR funds that could definitely be redirected toward ending homelessness. I think my hope is that this great push that's on right now nationally by the police chiefs to end incarceration or prevent incarceration for a lot of people in our prisons right now could result in some savings, and we know Proposition 47 will result in some savings. So all of those efforts, I think, could allow us to redirect some of the funding now going toward prisons.
There's California Department of Corrections has women's facilities. I think there's about 10,000 people.
Less than that.
Less than that now?
Yeah.
It's less. Senator Lieu and I visited some of the facilities, and we found that the women's facilities are actually the most overcrowded facilities in the Department of Corrections, number one. Number two, they don't have equivalent services for the inmates at those facilities compared to the other facilities in the system. And one option was Senator Lieu. You could maybe talk about this, but she had a bill that was approved by law that allowed some, what was it, transitional programs for women
With children.
with children. Now, it seems like a lot of those kids happen to be foster kids.
Right.
Okay, as we know. So you're spending money on the incarceration, $60,000, and then you're spending money on the kids of the person in the incarceration. That's like a group home for foster care is $7,000 to $10,000 a month. Okay, so we're spending money on both these things. So it seems like a very logical thing to look at that, and that's just for one foster kid. If you have two kids, then it's double that. Okay.
Right.
So it seems like that could be an area of maybe repurposing some of the funds. Has any of the groups in supportive housing examined this particular area?
I think have looked at, for foster kids, how we've tried to find some data around how many of those kids are in foster care because one or both parents are incarcerated. And we haven't come across any real great data, but come across data indicating that that is a large population of...
He's still here.
Are you looking for Dan Flaming?
Daniel, yeah.
I think he may have left.
We'll find out.
Okay.
But
it definitely is worth
pointing out that this
exploring.
is a lot of money. I mean, we're spending a ton of money on this. Okay.
Right.
So if there's one mom in prison and then two kids in foster care, you could be talking about a couple $100,000 a year.
I think one of the notions behind our Bringing Families Home budget proposal was to try and impress upon the legislators how much money we're spending on foster care for a lot of families who are homeless. And one of the greatest benefits of getting people in families into housing is just being able to address a lot of the conditions that lead to kids going into foster care, substance use disorders, mental health issues. A lot of those issues are behind families going into foster care and could be addressed if the parent, and oftentimes these are single adult women who are parents. A lot of them have been in the foster care system themselves as children. If we could break that cycle, that could make a huge difference in the lives of those families, but also in how much we're spending in the foster care system.
Yeah, like about 5 years ago, when we talk about AB 12, which we talked about earlier, we looked at the unification strategy for foster kids, try to get the families back together and unify them and work with the dependency courts, the judges, and there's been a lot of support for that. However, I think we didn't look at it maybe broad enough to look at this particular problem of women and the families getting into the criminal justice system becoming incarcerated or becoming homeless, and having the homelessness actually cause the child to be put into the foster care system. And you know, foster care is supposed to be for children that suffer from abuse, and not because the family is homeless. And so abuse meaning sexual abuse or physical abuse, something like that, or neglect. Those are the three categories. So we're not supposed to put kids in because the family is economically deprived. So economic deprivation should not be a reason
Well,
for a kid going into foster care.
I don't think, technically, I don't think any child in California is put in foster care because the family is homeless. But there are a lot of other reasons that relate to the homelessness. The stresses that it puts on a family. Sometimes a social worker may feel that that family is not living in a safe place because they're on the streets or in a shelter that...
Well, that's what I meant.
Right. So, you know, really, if you look at foster care data, the great number of families in foster care are also living in poverty. Most families in the child welfare system are poor, and then if you segment that further, a lot of them are homeless, or they've recently been homeless because they are either the parents have disabilities or the family's been living in an unsafe place or not stably housed. So there is just this huge intersection, even though, like you said, legally they cannot take away a child because the family is homeless.
And I think policies like reducing the number of months that somebody is on CalWORKs and cutting off the CalWORKs grants has pushed people into poverty, and therefore has caused an increase in the number of kids going into foster care. So there's this broad policy level interrelationship that we ought to understand better, and I think some of the studies that have been done and testimony by you have helped us do that. But those are the kinds of issues we ought to draw attention to in the legislature, to understand that we're just spending money reacting to things and making silo-based policies where we should be maybe looking at a more integrated, broader fashion in terms of solutions. So I appreciate you being here.
Thank you.
And we'll invite, thank you very much. We'll invite, Senator Liu, you have any comments?
No.
We'll invite the public to testify, please. And please come forward. How many people would like to testify? Can we have a few people that have, okay, this is good. Okay, please proceed. Yes, sir. Welcome and introduce yourself, please.
Good morning, Senate Committee. Good morning, Senate Committee on Transportation and Housing. My name is General Jeff. I am a Skid Row resident and Skid Row community activist and a Skid Row leader. I want to also thank Senators Bell and Senator Liu for wanting to take a tour throughout Los Angeles in terms of viewing homelessness. I want to also be clear in saying that there are two sides to every story. And so while you're only going to hear one side of the story through the perspective of the nonprofits, to understand the Skid Row residents also have a perspective. And I want to personally invite you to also take a tour of Skid Row and see Skid Row through our eyes. It's unfortunate that what you're going to see is you're going to see the majority of population in Skid Row is African American, more specifically black males. Also in Skid Row, everyone knows that Skid Row is the homeless capital of America. Also in Skid Row, fire station number 9 is the busiest fire station in the nation, and there are not a whole lot of forest fires happening in Skid Row, obviously. So, you know, there's environmental issues, there's public health issues, you know, there's no sense of urgency to the point where people are dying in Skid Row. And in case you don't know, Skid Row is a 50 city blocks as declared by the city of Los Angeles. 3rd Street to the north, 7th Street to the south, Main Street to the west, and Alameda Street to the east. That's 50 city blocks. And so there's a dire need for support. Not only on a local level, but a state level, and ultimately a federal level. It's unfortunate that the presenters here today do not equate what our community looks like in Skid Row. There's 0 black presenters here, 0 nonprofit heads here that are African American. Instead, what was revealed today was nothing more than the Smoke and Mirrors campaign. Because us in the community, from our perspective, Skid Row is actually at deplorable conditions, to the point where all we're doing is we're tired of hearing the empty rhetoric. So the solutions that they're offering, we're talking about coordinated entry system. That's nothing more than a database. For the city agencies and government agencies to declare full support for this. It's nothing more than a database, and it's not even mandatory, it's voluntary. So what happens if the homeless folks don't want to volunteer this information? All this funding and resources will be wasted. We need to come up with viable solutions that actually work. Some of these presenters, they created the Home for Good project, which is actually the main problem that created this expansive backlog that is actually exploding in regards to homelessness across our city. And here's why. There's been a waiting list on the SROs, which is low-income housing in Skid Row. And so when Home for Good came online, they claimed, falsely claimed that, and irresponsibly claimed that they would end homelessness in terms of, and specifically focusing on vets and chronically homeless in 5 years, which, is ludicrous at best. And so you're giving out false hope to our community. And we expect a public apology when they fail. And so what they did was they didn't put shovels in the ground to build housing. What they did was they just got some funding, and just bought housing from existing housing stock that was already in place. And so with that, they created a backlog from the waiting list that these people are still waiting to be housed. And then now they've created another solution, CES, and now people have to sign up, go from one waiting list to another waiting list. That's not the way that's not going to get it done. And so, we talk about the homeless vets, and we want to talk about citywide. On the Westwood campus, there is, all this, 388 acres that are not going all towards creating homeless housing for the homeless vets. And so, all these solutions is nothing more than snake oil. And we really need, there's a state of emergency has been declared here locally. We need a state of emergency declared in the state. We hope that you will be our point persons to actually make that happen in Sacramento. And we also hope that you will join our state legislators in Los Angeles to, encourage Washington, D.C. to also initiate a state of emergency in Washington, D.C. as well. I can go on, but for the sake of time and other speakers, I'll stop there. Thank you.
Keep in touch, okay? Yeah, we want people to be about 2 minutes or so.
Thank you. My name is Kwasi Nkrumah. I am the president of the Echo Park Neighborhood Council. Neighborhood councils here in Los Angeles were established so that citizens living in different localities around the city could speak directly to public officials on behalf of their constituents. In our area of the city, which includes the Dodger Stadium area, is very close to downtown, there is a land rush going on, like there is all over Los Angeles, any area within 1.5 miles of the center of downtown, because the demographic patterns are beginning to shift. People no longer think that it's an advantage to live in suburbs. They now want to live close to the center of the city. And so we are finding more and more people with higher incomes gravitating to our area. In the meantime, we have large numbers of people who have lived in our community, in some cases for generations, families, working people. These constituents are being pushed out of accessible housing at an alarming rate. There was an article in the LA Times about a month ago indicating that an average of 13,000 people per month are being displaced out of housing in LA because of the pressures on the housing market. This is part of what is creating this homeless state of emergency in our community and in many other communities around the state. Now, what we really need is some type of public policy statewide that requires localities to develop housing plans that ensure that we are not pushed into state of emergencies because people cannot access housing. About a year ago, not quite a year ago, we did a homeless count in our area. At that time, we actually had to search for many of the homeless in our area. Now, in less than a year, we have massive numbers of people living under the freeways, living in the parks, living in any area where they can find a place to pitch a tent or whatever, simply to have a place to lay down at night. These are, as well as many single men, families, women, elderly people, young people. I mean, it's the whole spectrum of a community that is being subjected to massive displacement. We need public policy that guarantees that people will have some access and requires localities to ensure that people have access to affordable housing. And if they don't have an income, then we need to make adequate provision that there is housing provided for that as well. Our state legislature, as well as our city council, and most of our elected government bodies have failed us. They have put a higher premium on the interests of those who make profits in real estate and other business pursuits than the interests of the people. And you know, this cannot continue indefinitely. People are tired. Look, I'm getting calls every other day from people in my area who are not against homeless people, but homeless people are crowding into our neighborhoods in ways that are unsafe, both for them and people in the neighborhood itself. They want a solution that doesn't penalize people for being homeless, but helps them. Thank you.
Hello, my name is Jessica Petros. I work at Hillsides with Youth Moving On. I'm here to speak about on behalf of all the homeless youth that are sleeping on our streets every day. Our program, we provide a continuum of services for transitional age youth, ranging from transitional housing, permanent housing, and workforce development services for former foster and probation youth. I'm seeing that it's working. I'm seeing that permanent, supportive, affordable housing linked with job training, paid jobs, and caring and compassionate adults. It's working for our youth, but there's not enough. We have youth coming in through our doors every day at our drop-in center, and there literally are not enough beds for these young adults, and we need more. I can spend a whole day calling every agency in LA County, and sometimes there is not a bed for them. Or on top of that, not age-specific programming that they need. Sometimes our youth would rather sleep on the parks in Pasadena than go down to Skid Row because they're kids and they're scared. And the groups that we're seeing every day that are slipping through the cracks are not just the former foster and probation youth, but they're the ones with severe mental illness, suffering from substance abuse, our children who are commercially and sexually exploited, our children who are parents themselves, homeless kids, giving birth to homeless kids, and there's not enough shelter for them. And so what I'm just asking for today is your support and your help in getting more funding to have more programs that they desperately need every single day. So thank you.
Good morning. My name is Melissa Schoonmaker, and I'm from the Los Angeles County Office of Education. And I just wanted to share with you, I was here for the presentation this morning, and a lot of the focus when we talked about youth was on foster youth. So I kind of go along with the speaker before me to say, don't forget about our unaccompanied youth, who could be anywhere from 14 to 25. And many of those services, you have to be over 18 to access a lot of services. There's not a lot, as the speaker before me was saying, that are age-appropriate services. These kids wind up in really incredibly dangerous situations, trying to just access resources. My job as the homeless liaison with the LA County Office of Ed is to work with school districts and our charter schools, which are 270 charter schools and 80 school districts across our county. and there's a homeless liaison in each district. So I also want to implore you, that as you go through and looking for solutions and collaborations, not to forget about the educational piece, because we want our kids to finish school, to graduate, to move on to college and pursue their dreams, but they need an education to make sure they're staying out of this cycle of poverty. So we're here to work with you and support your efforts. We just want, don't forget about our kids, and they're not all foster youth, and so just please keep that in mind as you pursue your next steps.
A question for you. In our county, we've been working on this particular issue that you're raising about the homeless students, and we're working with the school districts on this and try to link them with housing. Do you keep or have you devised a way of finding out how many homeless youth there are? Because I think one of the problems is a lot of the kids don't want to tell anybody that they're homeless, right? So have you figured out how to connect those kids with services, given their reluctance to come forward and say, hey, I'm homeless, I don't live with my abusive family anymore, but I'm not in the foster care system, I don't, you get what I'm saying?
Mm-hmm.
So,
as our homeless liaisons, their job is to help to identify and serve these youth. So it's a lot of multi-prong approach with training not only, the people at the school district, but also families, and reaching out to youth to say, if you or somebody is in the situation, please come forward. And that's about, or you have a student residency questionnaire that they can fill out and self-identify. So our unaccompanied youth, even if they can show up at a school without a parent, they can enroll in school with the help of that homeless liaison. And so I know for LA County, we have over 67,000 homeless students, babies to age 22 because of special ed, the younger ones because of Head Start, that are in these situations. But we also follow the McKinney-Vento definition, which is much more expansive than the HUD definition. Right. And I know we have about 500 homeless youth who are unaccompanied, and I know that is not accurate. I know there's more kids out there, but they're afraid to step forward.
They don't want to tell people.
Right.
Yeah, this is a problem we have to focus on. Thank you.
Thank you.
Hello, I'm Brandy Orton. I'm with the Los Angeles Aging Advocacy Coalition. The one thing that I have not heard represented in this room yet is the number of seniors that are facing homelessness. We work on different fiscal and policy priorities to help strengthen, preserve, and protect access to care for seniors. Currently, there's 1.2 million age 60 plus in LA County, 750,000 age 60 plus in LA City. Over half of those are culturally diverse, and a fourth of those are economically vulnerable. These numbers are expected to double over the next 15 years. 76% of Hispanic seniors age 50 to 64 have zero savings for health care or housing costs. This is looking at the baby boomer generation as they are coming up, as the older seniors are aging out. There is going to be a housing crisis for seniors. There is currently not enough affordable housing for seniors as there is. That, coupled with the fact that the 80 plus is the fastest growing population in the United States. 1 in 2 over the age of 80 is diagnosed with dementia. We have family caregivers in the ages of 50 and 60 leaving the workforce, not contributing to their Social Security, not contributing to retirement. As these people age, it will replicate the cycle of the need of the affordable housing due to the sheer number of people that are aging in California. We ask that you please take into account that seniors will cost the state a lot of money if we don't start looking at this now and earmarking some of that funding specifically for seniors. Thank you.
Good morning. My name is Adriana Mendoza, and I'm a manager of outreach programs for ARP California, and also a member of the Los Angeles Aging Advocacy Coalition. So thank you, Senators, for hosting this forum today. The average age of a homeless older adult is 53, with a life expectancy of 64. Older homeless people have a higher frequency of health problems and frailty than younger homeless people. They are therefore less likely to survive exposure to severe conditions such as extreme heat or cold weather. They are also more vulnerable to unsafe and unsanitary conditions, which can exacerbate health problems that may accompany aging. Homelessness and nursing homes are a last resort for older adults with unaddressed housing needs. Policy interventions can reduce the numbers of older adults who are in these circumstances. The physical and mental health of this group may suffer without adequate housing or regular medical and support services. Homeless older adults have a mortality rate that is 3 to 4 times that of the general population. That's why AARP supports legislation that removes barriers to building affordable housing throughout the state. In California, our primary priority issue is livable communities for all ages. And we are working in local jurisdictions to support local efforts that create solutions to help end homelessness. We are fighting at the federal level to restore cost of living increases to Social Security, and at the state level to restore cuts to SSI and SSB. Thank you.
Good morning, maybe good afternoon now. My name is Eric Arez. I am here on behalf of the Right to Rest Coalition and the Western Regional Advocacy Project. We are a 150 organization statewide coalition who are working to end the criminalization of homelessness. We are currently co-sponsors of SB 608, the Right to Rest Act, which is authored by Senator Liu. Just wanted to say a couple things. As you're on your tour today, I would encourage you to look at the community of Skid Row from a particular lens, which is not only the lens of homelessness, but understanding that Skid Row is the most heavily policed community in the entire country in terms of officers per capita in the 50 square block area. And I say that because a couple of things you didn't hear today from the experts who are representing a lot of the models that, that should be highlighted is that there is a 15,000 person wait list in the coordinated entry system, right? 15,000 people. And that for what the city is doing to try to reprioritize sort of the approach to homelessness, last year, the city spent $100 million on homelessness. 87 of that 100 million went to LAPD to largely arrest and harass homelessness. And so it's important. It is impossible to have these discussions. We shouldn't have these discussions without discussing how law enforcement and policing oftentimes is de facto policy in managing homelessness. And so while we're trying to end the crisis and create and highlight the models for change that are successful and evidence-based, we have to have the discussion around, you know, how it's difficult to get somebody on the CES system if they're hiding in different areas for fear of being harassed or cited or arrested for homeless, or it's impossible for an outreach worker to connect with a homeless individual if they are in jail, or it's hard for someone who's homeless to get a job if they have an arrest record simply for life-sustaining activities like resting, sleeping. And so we can start with SB 608. I know I'm preaching to the choir a little bit because the bill is currently in your committee, Senator Bell, and is sponsored by Senator Liu. So we know you all have an opportunity to push that excuse me? An opportunity to move that forward, but really I think it's important to go beyond that way, to take this message back to the legislature, and as different government levels are having these discussions, city, county, statewide, understanding that the city of LA passed a motion opposing the Right to Rest Act, right? And so we have to have those conversations that are not easy, that are difficult conversations, but that are essential, because we cannot highlight and talk about these issues. We cannot fully implement these successful solutions unless we begin to tackle the issues that are directly preventing these solutions from being successful. So again, here support SB 608, supportive of these models, supportive of this hearing, but we have to uplift the issue of criminalization of homelessness because we are not going to arrest our way out of this issue. Thank you.
Hello, my name is Becky Dennison. I'm with the Los Angeles Community Action Network, and we do community organizing in downtown and South LA. I also just want to highlight a couple of things that didn't get talked about on the panel, although I agree there were a lot of best practices, and the real issue is scale. None of these practices can make a real impact unless they're brought to scale, and the need far outweighs the supply of housing and services. So I do want to talk about the number of units, and particularly here in Los Angeles. Los Angeles needs state support. They need investment in housing. They need state money to increase our housing, but it has to be tied to a real commitment to doing that. It's taken the city 8 years just to produce, not even get to the level of the 1,250 supportive housing units that were required by litigation. At that rate, it would take the city 60 years to meet its own stated need for permanent supportive housing. That is not acceptable. It is not acceptable to put $10 million into the Affordable Housing Trust Fund and $87 million into arresting homeless people, meaning that homeless folks make up 15% of the arrests in the city of Los Angeles and less than 1% of the population. So there's just a mismatch in terms of producing units as opposed to policing people. And we have to, so those resources have to be tied to units for the most in need, a real tangible difference in new units coming online, not the switching around of subsidies, which is really important as well, targeting those most in need, but producing the housing and stopping the criminalization. And I also just want to say the other thing that was not mentioned is institutional racism and its role in homelessness. That's not just specific to Skid Row. County-wide, 1 in 18 African Americans are homeless, 1 in 250 white folks and Latinos are homeless. This is a real problem, both in our housing market, in our job market, but also in LAPD. It is no question that LAPD is the most brutal police force in the country right now, has killed the most people, has killed the most African Americans, and about a third of the folks they've killed this year are also homeless. So we've got to remove the police department from this aspect of our communities. They are not an expert on homelessness. They shouldn't be dealing with homeless folks, and they certainly shouldn't be shooting and killing homeless folks. So that's the shift we need here in Los Angeles. Again, don't discount any of the good practices that are happening, but until we solve those fundamental problems, Los Angeles will remain in crisis.
Good morning, committee members. Thank you for traveling to Los Angeles to hear the voices of the community and folks that are impacted by these issues. I just want to point out a couple things. I agree with and echo. I'm sorry, my name is Steve Diaz, and I am with the LA Community Action Network as well. I just want to point out a couple things. I echo the sentiment of the previous speakers, but I do want to point out a couple things that were missing from the representative of the mayor's office report back. While the city of Los Angeles is engaging in tons of political sort of conversations, their actions are still not being met by actual impacts. And when I say that to say they're talking about a $100 million investment, but yet they're still investing all that money into policing to criminalize people and not actually investing $100 million into housing. They talk about the city of Los Angeles is taking on efforts to end homelessness, but at the same time, they're not talking about the policies that they just passed, specifically not allowing individuals to have personal property on sidewalks. If you don't have a unit to go to, where else are you going to be able to keep your housing? It is unfair and unjust when you think about the requirement that you would have to get up your stuff, move around, unless move around every 24 hours, and if you didn't do that, you'd be thrown in jail. It's not, the city of Los Angeles comes up and talks about sort of, we're taking new steps, but yet all we see in downtown and throughout the city of Los Angeles is the criminalization that continues to happen. The city just passed 5611, 63344, geared at homeless folks. The city is constantly giving tickets for 4118D, sleeping on the street. The impact of that ticket is humongous. When you look at it, somebody who has a ticket, you get a ticket, sometimes it goes into collection. Once it goes into collection, it impacts your credit report. When it impacts your credit report, it impacts the way an employer will look at you for certain jobs. So Mr. Fleming talked about 70%, the answer to one of his study group, 70% of that was to find employment. How can you find employment if you're still stuck in the criminal justice system? This is why it's a really good opportunity for the state and can take leadership in ensuring that the cities and Los Angeles and other cities end criminalization by supporting the Senator's bill, SB 608. Thank you.
Teresa Young, this is short. Listening to all of the people before me, it's imperative that we take a good look at this group of people. As they are part of our community, they are part of us. And if this community becomes ill, because they are part of our community, we could also become ill with whatever disease. In fact, there are a number of papers that have been written, especially in New York during the 80s, when two of the most terrible diseases accumulated first in the homeless population and then moved on into the other parts of the population. So to play any games, to let things drop on this subject, puts all citizens in this community, in California, in the nation, at risk. This is vital that we take a good look at these people and make sure that they have their place. Having a home does psychological things, increases better things for them. But they need more. If they've been chronically out in the street, there's a whole host of psychological issues, and their immune systems are definitely in the toilet. They really are. I grew up with my grandparents who actually hired homeless, so they lived with us. And the people that lived with us were sort of a cross-section of who I have met in the homeless community today. With a large number of veterans that are coming home, one of the homeless people that lived with us, he was a very skilled person, very smart, but he had terrible episodes that made it so that he had to live back out on the street again. And those things need to be dealt with, because we have a lot of people who are coming back from our multiple wars. Thank you.
Good morning, I'm Sean Gregory with LA Cannon Rap, also homeless for 5 years. Quickly, I think the stereotypes of homelessness should be dropped right now, like they're lazy and help resistant. I was in transitional housing that I lost because my father was dying. So I went to Texas to take care of him, and I wrote my case manager, emailed her, I even talked to her on the phone while I was there. She said everything was good. I came back, he ended up living about 2 weeks since I was there, and when I came back, all my stuff was packed out, and my room was ultimately given away to someone else. That's just one point that needs to get across real quick. Another one, just to reiterate the point that criminalizing homelessness only perpetuates the problem. We need to stop giving what limited resources we have to the LAPD to criminalize the homeless and give that for supportive, affordable housing. We need to stop talking about the need for that and start creating it, especially when the rest of downtown LA is under construction with luxury apartments and lofts. And just to thank you, Carol Lou, for your tireless efforts on the decriminalization of homelessness and SB 608. You are nothing short of a champion, and we appreciate you. And Jim, we're gonna need your support as well, and all your colleagues and peers. Thank you.
Okay. My name is Mary Ramirez. I am from the San Fernando Valley. I have been homeless for 11 years. I have filled out what is called the SPLDOT for this data entry system. I filled out 3 of them. One at LA Family Housing for a transitional shelter, which I never got into. The second, I filled it out at a winter shelter, which they offered me shared housing. Not very acceptable. The third, I filled out at something called the Connect Day. I got a shower. Wow. I got a backpack that fell apart on me. Nobody contacted me. I've gone to other Connect Days, the same thing. And another thing we have in the Valley is I take showers at an agency called Hope of the Valley. Hope of the Valley is leaving Sun Valley. It is moving to Van Nuys. They don't like homeless people in Van Nuys. The church that they're giving us the showers at told us we have to go somewhere else between our meals and our showers. This is where the right to rest comes into. They will be harassed by the police, who has kicked them out. And that is all I've got to say. Thank you.
Good afternoon, Senators. My name is General Dogon, and I'm born and raised right here on Skid Row, and I'm also a civil rights organizer with LA Can. Just a week and a half ago, the mayor and the 5 other city council members stood right outside this door right here on the line and declared a state of emergency on homelessness. I was there at that press conference, and I said, where's Chief Beck at? And Herb Weston shouted back out to me and said, this is not about Chief Beck. 3 days later, LAPD shot and killed a homeless woman just less than 20 blocks away from where they declared the state of emergency on 21st and San Pedro. For the last 9 years, residents on Skid Row, I've been organizing residents to fight back against the racist and oppressive police initiative, Safer Cities Initiative, which is a police initiative that came downtown to basically gentrify poor and homeless people out of Skid Row. And basically for the last 9 years, what they've been doing is billy clubbing homeless people from South Central to Venice to Hollywood to the county jail back to Skid Row. Just running a recycle system, right? A waste of resources. Hundreds of $millions have been put into LAPD to police their way out of homelessness. And I agree with the brother that came up here earlier and said about what the mayor, they come up here and they speak. They talk that good sounding about what the city got planned and what they're doing, but actually all the money is going to the police. Check the books. You'll see that the police is getting all the money. Just last week, right across the hallway, they had a homeless committee. They created a committee within the last couple of months to address this issue, right? And last week, the Business Improvement District was in here, right? And every last one of them got up there and was talking about we need the city right now to get up and move and enforce and get these people off the streets. Where they go, we don't care. We want you to get out there and get them. And that's what the city's been listening to. They've been doing that. But it's time for a new day. And I thank y'all for coming down here, and I think you guys are the start of this new day. But that's going to take a while for this thing to manifest. So it's things you can do right now on the block to stop some things. One, you can tell the mayor and you can tell Chief Beck that we ain't giving you a dime until you stop the enforcement. Because no matter what all these folks get up here, they got some good ideas and plans, it ain't gonna happen. Because as long as Chief Beck got the guys out there with them billy clubs, swinging them billy clubs, people are gonna be running. And they're not gonna be able to sit long enough to get nothing. All right? Two is that you need to start investing into community. Right? I heard some of these academics, but some of these academics is still in college, right? They ain't graduated yet. The residents, community organizers, we on the streets. We on the streets. We know the folks that's on the street. Those are our loved ones, right? We in the trenches out there every day with them. We got the communication going with them. We know the solution. We know the problem. They need to invest into community, right? And I want to say also is that I'm gonna see you today, and I'm gonna join you on that tour. And we're going to get down to business, and we're going to point out some real issues on Skid Row. Thank you for your time.
It works. Works for me. Good morning. My name is Lisa Hayes, and I am the Director of Disability and Senior Access Services for Molina Healthcare. We are as an organization, a part of the Health Homes Initiative, and very excited to see your senators' support of finding a solution to the housing situation. The one thing that I saw or heard missing in a lot of the conversations today was accessible housing. At least 20%, were the last numbers that I've seen of people that are homeless are physically disabled. The very last thing we want to do is find homes for people so that they'll become prisoners in their home. If they can't get out, if there's no stairs, or if there's stairs and there are elevators. So we want to make sure that that word accessible also gets included. So it should be accessible, affordable housing. And we just wanted to, I just wanted to make sure that that is on, as you guys are helping and delivering and trying to find solutions, that we include people with physical disabilities. Thank you.
Hi, my name's Alan Ehrlich. I'm from South Pasadena, and I'm not here to represent any organization. I'd like to thank the committee. I'd like to thank the committee for bringing this hearing down to Los Angeles. As you've heard today, there are many different faces of homelessness. One of the issues that hasn't really been talked about is mental health. Senator Buell, you said that, Bill, that under state law, insurers are required to provide coverage for schizophrenic treatment. The problem with that is that since the 1960s, when we emptied out the psychiatric hospitals, you can't compel people to accept the treatment. And arresting people for a 48-hour hold on a 5150, if they're not getting treatment and then being put out on the street with no follow-up, doesn't solve that problem. When you take your tour of 6th Street and Los Angeles Street in San Pedro later this afternoon, you're not going to be seeing a lot of kids being homeless down there. You're going to see a lot of people with mental illness. They're not being served. And throughout the hearings today, something that I heard nobody speak about, and this really goes to the United Way and the churches and the other social agencies that are stepping up to the problem. Utah has a program called Housing First that's been very successful, and between 2013 and 14, they reduced homelessness 10% statewide. The standard approach for most of the social service agencies is we won't take you in until you're sober and clean. Well, this doesn't help solve the homelessness problem either. If you give them housing first, you give dignity back to people, you give them a safe place to secure their belongings, and you can, instead of making them go to the city and county to find the social services, which is very difficult if you've got mental illness, you can bring the social services to them. Imagine if I could go downstairs and there's somebody from the Department of Health and somebody with a job training program and all of the other social services, caseworkers. That makes it a lot easier for me to get back on my feet and become a productive member of society instead of somebody who's needing services from society. I already sent this to Senator Liu's office, but I've got here a list of about a dozen articles, including from NBC News, New Yorker Magazine, Pathways to Housing, that have all talked about the Utah program, Housing First. And I would really like to pass it out to all of the members of the committee right now.
Yeah, thank you.
Thank you.
Yeah, I've read some of those articles. I'm familiar with what's going on in Utah. Yes, ma'am, please come forward.
I'll be really brief. My name's Eve Garrow. I'm from the ACLU of Southern California. We are, of course, very much in support of SB 608, the Right to Rest Act. One thing I don't think that comes through loudly enough in some of the dialogue about the criminalization of homelessness is the fear that people feel and the damage that that does to their mental health. So we're talking about people who are chronically homeless with severe mental health issues being criminalized for being outdoors when they have no other place to be. In some litigation that we're bringing in Laguna Beach to have them stop enforcing their ordinances that criminalize homelessness, I've been talking to a lot of people who experience this. People end up feeling suicidal, experiencing sleep deprivation, which is terrible for their mental health, ending up in the hospital because of this criminalization regime. It's just, I feel that it's so detrimental to any effort to solving the homeless problem, and it's just a critical component along with the housing that people need. I'll just give one example of a gentleman I was speaking with last night, as a matter of fact, who tries to go to the local shelter, gets rejected because there's not enough space, tries to sleep in the parking lot of the shelter because he feels that it's the only safe place that he could be. If something were to happen, at least he can bang on the door of the shelter to try to get help. And the police come and give him a ticket for sleeping in the parking lot, even though he tried to obtain shelter for the night and to obey the law. He became so desperate that he wanted to kill himself, ended up in the hospital for 10 days, lost the job that he had, and had to just sort of start all over, trying to rebuild his life again from scratch. So these are the kinds of stories I'm hearing. I just thought I'd share that with you briefly and commend you for your work on the Right to Rest Act.
Thank you. Okay. In conclusion here, this is our hearing on this. We're going to be working, we're going to go out in the community today and beyond that. I'm a member of the local homeless task force in Santa Clara County, okay, San Jose. And we've been working for several years on homelessness and have recommended and have allocated money to build housing, have adopted a housing first strategy, and are working on decriminalization issues. I think as a state, we need to follow those kinds of issues. If somebody's arrested, statistics show that just the mere fact they're arrested and incarcerated, it destroys their economic potential by 30 to 40%, and creates, in effect, poverty for that person because of the inability to find work. I think that racial issues are important to recognize. When we explored the issue of training of police officers in my bills this year that were signed into law, SB 11 and 29, regarding mandating the training of police officers on mental health and developmental disabilities issues, we put in that bill that they also should be trained in cultural competency. And I think if your police academies had those kinds of training programs and then programs in the field training, we would become more aware of that particular issue when we select police officers for public service. And I think that's very important that we do that. Today I'm going to be visiting several facilities in the community, and I hope to learn even further what's going on. And the Senate is very interested in this subject. This will be a focus of this committee. We will also focus on the criminal aspects in another committee I'm on, which is, I happen to be a member of the Budget Subcommittee on Public Safety and Criminal Justice, which deals with budgets for the Department of Corrections. And I'm very interested in solutions that decriminalize and reduce incarceration. So thank you for attending. We will continue to work on this with our colleagues in the Senate, and I'll ask Senator Liu if she has any concluding remarks. Senator?
Thank you very much, Senator Bell, and I appreciate everybody's comments and presentations today. While I don't sit on transportation and I don't sit on the budget subcommittee, I am committed to this issue. I just think it's it is a situation in our larger society that we all need to treat each other with more humanity and appreciate where we all come from and create a system that works for everybody. So we're going to continue to look at this and try to redirect resources to address this issue. And it has to be more than just talking about it. It really, when we talk about a 5-year plan, some people just don't have 5 years. And so it's a real, it's a very difficult conversation, but it's a real problem that we need to solve sooner than later so that we have a healthier environment for all of us. So thank you very, very much for attending today.